Chairman, we're now live. We can start the meeting.
Thank you very much. I must apologise for all the difficulties we've had this morning. I don't think anyone's escaped. Totally difficulty free. But here we are. Good morning, everybody. Nice to see you. Item number 1, do we have any apologies for absence?
I've received no apologies for absence, Chairman.
Thank you. Declarations of interest. Does anyone wish to declare any interest which they already haven't declared as the annual paperwork? No additional interests. We now come to item number 3, pages 1 to 8, to confirm the minutes of the meeting held on Tuesday, the 9th of November. Does anyone propose that we confirm these minutes? Joe, you've gone silent again.
I think Councillor Kate Cody has just raised her hand, Chairman.
Thank you, Kate. Would anyone wish to second that? And Steve Robinson seconded it, so we're away there. The minutes have been accepted for the meeting of the 7th of September. We now come on to item number 4.
Sorry, Chairman. I think Councillor Cody wanted to say something. Is that right?
Sorry, Kate.
Thank you. Sorry. Yeah, I'm very grateful. I asked some questions from the last meeting and they were answered, but I do have a question following that. Is this the appropriate time to ask that question?
Yes, it is.
Okay, thank you. So I asked some questions around park homes. As I say, very grateful for the answers, appreciate those. I just wanted it confirmed, the heat pumps that didn't go into the park homes, they went into rural homes. Can I just have that confirmed that these were homes that were on a low income?
Sarah, would you like me to take that away and we'll get a response to Councillor Cody after the meeting? Is that all right, Councillor
We'll have to check with Neil Penny, but yeah, we can
Brilliant. That. Thanks very much. Thank you.
Okay, can we proceed? Has anyone got any more matters they wish to shout at us? So we now come to number 4, which is the Public Health Annual Report, pages 9 to 38. We welcome to the meeting very hard-working, run off her feet, Sarah Scott.
Thanks, Chair. And I've got an amazing team, so I don't do all this by myself. So just to say that. And so thank you for the opportunity to present this report. This is my 6th annual report as a Director of Public Health. And as some of you may know, that I'm required to produce a report every year that really holds the mirror up to our population to try and focus on specific aspects that are affecting our population and try and encourage the system to respond. So it very much builds on the last 2 that my team and I have written, and this is a joint effort with my team. I don't sit in a darkened room and write these on my own. I have, as I said, a wonderful team that helps research and helps me write them. So this is very much a joint effort. So the last 2 years ago, we produced one called Healthonomics that talks about health inequalities and how we tackle that through inclusive growth and how you can't have health without wealth, essentially. And then last year, we looked at race and inequality in COVID and how the COVID has had a disproportionate impact on some parts of our population. So this year, we focus on something called anchor institutions, and we've called our report Sources of Strength. So Siobhan, are you able to share your screen? So you can go to the second slide, please. So I'm doing my best Chris Whitty impression all the way throughout this. So what's an anchor institution? An anchor institution is something that is really rooted in a place. It's unlikely to relocate, and they have a significant interest and stake in their local area. So examples are quite often found in the statutory sector in terms of councils. Gloucestershire County Council is never going to up sticks and move to Swindon. We're always going to have our base in the county, and we're always going to be invested in our population, as are our police force, our fire service, our universities, and our local NHS trusts. And they also have quite sizable assets and they employ quite a lot of local population. And as we know, only around 20 to 25% of the factors that influence our health are related to access and quality of and experience of the healthcare itself. Other factors like employment and housing and education have a much greater influence. So tackling inequalities, as we know, is really complex and requires that joined up approach. And anchor institutions can play a joined up role in how we contribute towards tackling these wider determinants of health and tackling inequalities. So on the next slide, we talk about who is an anchor institution. I've already mentioned public sector, and traditionally that's been the definition of what an anchor institution is. But when we were researching the report, we felt that there was an opportunity to broaden this definition for Gloucestershire. And so we've come up with the concept of community anchors, that's on the next slide, and business anchors. So throughout the pandemic, we found that our really vibrant voluntary community sector were doing some brilliant work around supporting their communities. But equally, a community and a voluntary sector organisation quite often are rooted in the place, and we've got some great examples around the county of community groups that are really invested in their local communities. So we've coined the concept of a community anchor institution and think that we can do the same amount of work with community anchor institutions as we can with the public sector ones. And we also think that we've got many private sector organisations that are anchored in their communities in Gloucestershire because of who they employ, how they invest their money, how they run their procurement, and who they choose to supply their goods. So we've coined the three phrases as part of the report. So as we move on to the next slide, the report broadly talks about 5 key areas that can help us implement an anchor institutions approach in our county. So they're employment, including recruitment and retention of the workforce, purchasing of goods and services, environmental sustainability, use of buildings and capital, and partnership working. And these are all practical ways that anchor institutions can influence the health and well-being of their local populations. I'm going to talk you briefly through these 5 areas in the next 5 slides. So we know that being in a job can have a really positive impact on your health and well-being, and we've discussed this in previous annual reports. But we also know unemployment is associated with an increased risk of limited long-term illness, for example, cardiovascular disease, poor mental health, and risk of suicide, and other health-damaging behaviours like smoking. And we discussed in the Healthonomics DPH annual report the benefits of good work and working for a good employer, and the value that can add to our lives. And I think in this report, we want to build on that. So the concept of being in employment and how anchor institutions can help with that, but also what employers can do to become a good employer. So committing to the real living wage for employed and contracted staff, supporting the health and well-being of your staff, supporting fair conditions of employment, and also supporting professional development and career progression can all help us become really, really good employers and invest in our local community. The next aspect of anchor institutions relates to procurement. And in 2012, the Social Value Act was brought in, and this places certain duties on public sector organisations, and these link strongly to our roles as an anchor institution. And I think that the pandemic that we've been living with for the last 2 years has certainly highlighted the importance of the voluntary and community sector in supporting the health and well-being of our residents. And we know that public sector financing has been really key to the survival of this sector through the last 2 years. And we know that some of our systems favoured larger voluntary community sector organisations, and we've had quite a lot of feedback that some of the smaller grassroots organisations struggle to access contracts and funding. So earlier last year, the Barnwood Trust in Gloucestershire conducted what they called a listening exercise to capture lessons learnt during the pandemic, and how the voluntary community sector contributed towards a resilient Gloucestershire. And in the report, we capture some of the lessons learned from this. But I think it's really important that that we recognise that, because the way we use our money, the way that we procure things as a statutory sector, as an organisation, as GCC, can have a significant impact on our voluntary and community sector. And there was some feedback throughout this listening exercise that the flexible approach taken to commissioning during the pandemic by the statutory sector has had a real impact, particularly on those small grassroots organisations. And there's something we want to retain that learning and make sure we take that into our commissioning and procurement activities going forward. So the next aspect of anchor institutions relates to buildings and capital. So the anchor institutions I've described, certainly in the statutory sector, have huge estate. If you look at all the estate across the 7 councils, the university, police, fire, and the NHS, huge amount of buildings. We also have huge buying power, and there's an opportunity to use that to try and support local communities. So all developments, whether they come with choices, about materials you use, workforce design, cost and sustainability, and involving communities throughout that process and providing targeted opportunities for local workers and organisations, and considering environmental sustainability can all help ensure that not only the health and wellbeing aspects are achieved through any local development, but also there's benefits for the local economy as well. And we know that housing is one of the most significant contributors towards our health and wellbeing, and those who lack stable housing also face some of the starkest health inequalities in our county. And the other aspect of buildings and capital, I think, sorry, Siobhan, the other aspects of buildings and capital and anchor institutions relates to community spaces, and many community groups struggle to access meeting space, as well as trying to fund decent quality meeting spaces to hold meetings and services and to have outreach to their local communities. And I know that many local authorities and anchor institutions already do make buildings available for community groups, whether it be on short-term tenancies or, but sometimes those restrictions around funding and availability of buildings can be a real hindrance to the work of some of our community sector. And there's an example in the report about Down to Earth, a community interest company in Stroud, which is really, really positive and developed allotments in the grounds of the Vale Community Hospital. So I think this encourages us to think a bit more creatively about how we can use some of our land, some of our buildings to best support our community groups. So the next slide talks about environmental sustainability, and I don't think that climate change and environmental sustainability have been so high on our agenda, and there's a lot more I think that we have to do, but I think the anchor institutions approach encourages another conversation about this, I think, and there's just some of the facts from the report there on the slide, and gives us another opportunity to act. The final element is around partnering in place, and I think partnership working underpins all of what we do in public health and the larger statutory sector, and is certainly a key concept in achieving an anchor institutions approach. The concept of place has become increasingly important, I think, over the last decade, and we can see that place focus has also become a way of working in some of our partners as well. So it's very clear in terms of our local NHS and the work of the integrated locality partnerships and primary care networks that investing in a place and the people and the services in that place is how they want to try and transform their services. We see it in the police and the neighbourhood policing approach, and also in different ways across the 7 councils across the county, but also in our, as I've mentioned, our active voluntary and community sector as well. So I think if we're going to consider ourselves to be and act as an anchor institution, then there's something we can progress even further in terms of the partnership agenda. One of the final slides is around strengthening communities, and we talk in the report about an asset-based community development approach, or ABCD. And lots of the district councils have taken an approach to strengthening communities, but we'll call it something slightly different. We also see this through some of the work in the police, that's also mentioned in the report, and through the clinical commissioning group and some of the work that they're doing. And I think this is also mirrored in the work under the Health and Wellbeing Board called the Gloucestershire Way, in terms of how we want to take a strengths-based approach, really building on the assets in communities rather than looking for what's wrong and what needs fixing, but working with what's there and building from that positive base upwards. So the report, as you would expect, makes some recommendations. The next 3 slides are quite wordy, so I'm just going to talk you through them. So there's 7 in total. The first one relates to an anchor institutions event that we held before Christmas that was really helpful, I think. The second one relates to recruitment and retention practices. The third one relates to social value and how that can enhance our anchor institutions approach. And our research has shown that our statutory sector colleagues are in different places in terms of implementing a social value approach. The fourth one on the next slide is quite a long recommendation, but essentially is asking for a strategic and operational lead from each of the main statutory sector organisations in Gloucestershire to work with us to try and further develop the anchor institutions approach in the county. The 5th recommendation talks about working with G1st LEP, the LEP, to develop a clearer role for the business anchor institutions, and we're investigating whether we can allocate some funding to create a fixed term post to develop this work even further. Number 6 talks about developing a collaborative across the county with everyone interested in developing an anchor institutions approach coming forward with their strategic and operational leads. And finally, we're going to publish an anchor institutions charter. So everyone that's been involved in certainly delivering recommendation number 6 will be able to sign up as an organisation and pledge to demonstrate their commitment to working in this different way. Right, that's a whistle-stop tour through my report. I'll pause there, and I'm happy to answer any questions.
Anyone have any questions about Sarah's presentation? Kate?
I can see that Mark and Kate have got their hands up.
Thank you, Chair. I think Mark was first, actually.
Thank you, Chair. Sarah, I just wanted to congratulate you and your team, because having read all 29 pages that you've just flown through, I found it absolutely fascinating and have not appreciated the breadth of work that you do and the initiatives which you're coming forward with. And if members on this committee haven't read your report in detail, I would encourage them to do so. So well done.
Yes, thank you, Mark. I totally agree with that.
Thank you.
Kate?
Thank you, Chair. Yeah, I found it, I read it as well. I found it really interesting, and I made copious notes, so I hope I won't go through all of them. I think it's a brilliant starting place, lots of possibilities, but I did feel it probably needed more practical solutions and specifics. I guess it's a starting point and it will go from there. I do have lots of questions. So I guess...
Can I just come in there, Kate? So I think the purpose of the report is to fundamentally to focus on tackling inequalities in the county. Now, some directors of public health approach this in a different way. When I was in a more junior position, I've helped write several DPH annual reports, and they tend to be quite long. Sometimes they're 100, 150 pages long, tend to be very data rich. And we've taken the decision locally to try and make them more action orientated, to try and hold the mirror up. So it deliberately hasn't got a lot of the solutions in it, because our role taking this forward then is to try and convene the system to say, well, actually, how could we take an anchor institutions approach? How do we take this forward? So the idea is we try and highlight some of the good practice that's going on in the county, and it's usually not very difficult at all to find examples of good practice in our county. But there is a lot of work to do here, without a shadow of a doubt. This is not a concept that we're showcasing to say, look, this is what we've done. It's an opportunity to say this is what we could do, and this is another way that we could better meet the health and wellbeing needs, or work collectively to improve the levels of health and wellbeing in our county. Yeah, so it's very much a start, I would say, rather than presenting something that's finished.
Okay, yeah, I would so love to do some work on this. I've got loads of ideas anyway. And I think you're right, there are some excellent positives here. The Vale Community Hospital allotments and the building with nature. I think they're really fine examples of how this practically actually could work. Well, I'll go to some of the questions then. It says in the report that the NHS Gloucestershire spent 1 billion on goods and services. Do we have, I'm not asking for an answer now, I wouldn't imagine you to have it, but do we have what percentage of this is already spent in Gloucestershire, so that can be worked from? There is a link, but unfortunately links don't work on iPads. So that's my first question. Shall I ask them and you answer, and then probably best? Yeah.
Do you want? I can respond to that. So I don't know off the top of my head. I think that we'll have to go away and find out the percentage that actually spent in county. But the idea being that we try and move some more of that to be spent in county to support the local economy. But sometimes with organisations like the NHS, because they've got a national procurement system that's slightly more difficult, it might be easier to make some inroads, for example, with the 7 councils who perhaps don't have as nationally determined procurement processes. But it doesn't mean to say we can't try.
Yeah, because I mean, obviously we've got the figure, so they know how much they've spent. So yeah, I appreciate that. Okay. I thought it was interesting as well that the NHS, it's 40% of the public, of the carbon footprint of that sector, of the public sector, and yet 76% of Gloucestershire people go to work by car. I mean, there are correlations here all over, aren't there, to actually find solutions. For me, I think the thing that did come out, and you said that yourself, this is about health and wealth and inequalities, and it just seems so obvious that if we actually paid more, or distributed wages more evenly, then that sort of, I think it's called trickle-up economics that's mentioned, would start to have some effect. That brings me to, again, that really stark figure there, that 85% of the NHS workers on less than 24,000, 85% of them are women. So the thing, huge things to look at here. Right, what else did I have? It really brought to mind as well things like when our local post office was closed. This was before COVID, and they couldn't open because there wasn't a single member of staff who was local, and the motorway was closed. Similarly, the other day I went to the optician, he was late because the motorway was closed. People not living close by, to where they live, and that sort of adverse effect it can have from travelling, which is causing the pollution, which is giving us the a lot of the ailments, etc. Okay, what else did I have? That was a positive. Yeah, covered that. I had a lot to say on that environmental sustainability slide. The impact of climate change on human health, although mental health is mentioned a couple of times in that graphic, I think it needs to be far more integrated into the whole thing, because just for example, increasing allergens, I know people who are, a particular woman who's absolutely into butterflies, but she can't go out and count them and look at them in the meadows at the times of year she wants to, because she's got severe allergies. And there are massive links, therefore, to her mental health and not being able to do the sort of things she wants. So I do think that the impact of climate change on human health, that mental health aspect should come into all of those slides, and also the sort of impact of losing green space and nature, and anxiety around climate and our biodiversity loss and all that. I think that maybe that could go in there. And then I just wanted to point out as well that kind of in terms of carbon footprints and things like that, it's quite often the wealthier that are causing a lot of these issues. They fly more, drive more, waste more, use more energy. I thought there was a link there, and also really looking at healthier lifestyles and how healthier people tend to use fewer resources as well. They, just in terms of obesity, medicine, all sorts of things like that. I did feel, and you have pointed out, and I thought that was going to be the case, that this is kind of a starting point, but things like just mentioning that all the councils have declared climate emergencies, they have, but to differing degrees and stages, and actions indeed, and that the statements of those sorts of things aren't necessarily enough. Again, coming back to air quality, 40,000 premature deaths per year in the UK due to outdoor air quality, but we're building more roads, and there's a lot of mention in here about looking at encouraging active travel, to where you work, for your benefit of your own benefit of health, but also the environment, and just looking at things that we can do. GCC, for instance, I've mentioned this already, but how free parking for members in the centre of Gloucester is ever going to encourage people to use public transport or active travel, those sorts of things. So there's just so much here. And then I just had a quick think, really, as to, I know that the major anchor institutions are, as you've pointed out, the local authorities, the NHS, the universities, those sorts of things. But but you're including others, and from a sort of business anchor point of view, looking at places like G4 Tech, Moog, aerospace, those sorts of businesses, we have quite a few of those in the borough of Tewkesbury, and it's quite interesting how the managers and executives and whatever tend to live further afield. It's the low-paid manufacturing staff that tend to be more local, and the procurement, how, when we can't do everything, I understand that, and it is very, very complex, but they buy components from places like Thailand and Malaysia because it's cheaper, or because of globalization, they have to outsource these days. Anyway, I just want to finish on, I think this economic growth, it's got to be distributed more fairly. It is better for everyone, but it doesn't really happen, because as wages go up, that it's proportionately more for those earning at the top of the scale. But I do want to finish on that Building for Nature siren system, which was a brilliant example, and the sorts of things that we want to look at. I could go on forever, but I shall stop.
But don't, Kate.
Exactly. Thank you.
Fine, thank you, Kate.
Do you want me just to respond to that, Stephen? So the comments are really helpful, Kate. Thank you. I think the thing we try and strike a balance with every year is covering a subject to a sufficient degree to prompt a discussion, which is really helpful, and your points are really relevant, and to try and provoke some action, versus producing a report that will be so long that no one would read it. So we try and keep them as short as possible. We try and make them as interesting to read. I think also trying to be mindful about what's in our gift to change. And some of the things you've talked about are not, but I think there are still quite a few things around developing an anchor institutions approach that would bring about tangible benefits to our population. But some of the big things about redistribution of wealth, whether someone buys a component from Thailand, I might not be able to influence that, but there are lots of things that we could do. And I think, in terms of recruitment and retention, tackling social mobility, there's lots of simple things I think that employers can do to improve recruitment and retention locally that would benefit the local population, but also organisations that are perhaps struggling around recruitment and retention. So I think what we tend to do is bring back updates after 6 to 12 months in terms of how we've got on with implementing the DPH report recommendations. I'm happy to do that if that's helpful, but I think your comments are really useful. Thank you.
This is just the start, though, isn't it? This paper here is just a start.
Could I just come back with one question? And it's around there was a press release about bonuses for staff, and I know Somerset Council have committed to a minimum of the £10.50 wage to their home care staff. And I know, is Gloucestershire going to do that? Because I know we're giving bonuses, but are we actually...
Can I cover that under the next section? It's quite relevant to the next paper. Is that okay?
Yeah, of course.
Okay, do we have any more questions or comments?
Councillor Stephen Robinson.
Steve Robinson, then Tim Harman.
Thank you, Stephen, and thank you very much.
There's a cop appearing through your door.
Oh, yes. Thank you very much, Sarah, for your excellent report and your team. Thank you. One was on, I'm not this is observations more. I'm not really convinced. I know we've made a start, but I'm not convinced that, on purchasing with the statutory organisations, really. And, I still tend to see these very large companies delivering food to schools, etc. We all know those companies. And, I think there's still a lot of work to be done with local companies to supply food to the statutory organisations. I didn't understand what you said about the National Health Service. They've got to buy nationally. They've got this national procurement. I didn't know that one, but I think there's still quite a bit of work that could be done to purchase locally, particularly food. You mentioned as well, which I was interested in when I was reading about the businesses, and I know I've lived long enough in my own division, and I can remember when there were 4 large factories that had their own sports facilities, their own social club, their own nurse in the factory, and that all helped so much. All those sporting facilities and their social clubs have all gone now. They've all been turned into small industrial units, which is great. But that sort of infrastructure, which I think we're missing now with local businesses, and also lastly, you mentioned about building and affordable homes, and that the county, the districts, the NHS all own all this land, But the problem is that everybody wants the top receipts for when they sell it. And you know, we could be building a lot more affordable homes. We've done it in our own through a CLT in Nailsworth, where we managed to get a plot of land from the district council for £1 and built 12 affordable homes that are rented in perpetuity. So you know, there are all these schemes that could.
I think you're frozen, Stephen.
I think we might have lost Stephen. Shall we come back to Stephen and go to Tim?
Yes, thank you. Tim was next.
Yeah, thank you. Hopefully you can all hear me. I'm not frozen.
Yes, we can.
Good morning. Good. Well, I'd just like to add my thanks to Sarah and the team for this report. It's a considerable piece of work, as you can imagine. A lot of people have input to it. A very useful document, and you know, it does give a very good framework going forward. And it will guide what we do. You know, that is the plan that guides us along the ways that we will proceed in the next 12 months and so on. I think I'm right in saying also, Sarah, that we make an offer to engage with the district councils each year with this, to receive this presentation if they would like to receive it. I know you've done that before. I've been with you at Cheltenham when you've done that. And I think that is important, that we do reach out and get their involvement, because in many ways, delivery is not something we as a county council could ever do on our own. All these things are very much a team effort from the NHS, local government, etc. But I think it's a great report, and well done.
Thank you.
Thanks, Tim. I'm actually going to Stroud District Council tonight, so happy to go and present to other councils if it's at all helpful.
Thank you.
I think Steve's still frozen.
Sarah, do you want to just summarise?
Oh, he's come back. He's come back to life.
Oh, Stephen. Councillor Robinson, are you there?
Yeah, I am. My Wi-Fi went down. I must have had too much to say.
Stephen, did you want to ask a question? Oh, we lost him again.
No. Mine was just observations.
Right.
Thank you.
Yeah.
Okay,
thank you,
Steve.
Sarah, are we asking the committee to agree the proposals, recommendations, the 7 recommendations? We're just asking to note them.
Just to note them.
And note the report.
So I think if there are no more questions, if Sarah wants to come back, but my understanding is that the committee note the report,
yes,
note the proposals, and that maybe in another 6 months we might have an updated progress report. Would that be right, Sarah?
Yep, and we also report back to the Health and Wellbeing Board as well, because it's leading the anchor institution's work. But I'm happy to bring. I can include a progress report in the DPH report for information.
Would a question and answer session be useful?
I believe we've already had that, haven't we, Sarah?
No, but a more depth-based question and answer session.
I think we need to go away and do some of the work.
Yes.
So if you give us the opportunity to do that, and then perhaps bring back some colleagues and maybe some colleagues from other organisations that are taking forward an anchor institution approach. There's about 14 organisations, I think, that have come forward to participate in this work. So my team are putting together a meeting in the next couple of weeks to start that. Siobhan will be chairing the group. So perhaps if you give us some time, and then we can report back on what we've learned and what's worked and what hasn't worked, because this is not a perfect linear process, is it? It's exploring how we can work better together and try out different approaches and what impact they will have.
Okay, we will do that then.
Perhaps we could ask Siobhan to chair the task and finish group to come back, and we'll wait, I would say, at least 6 months for that work to start to bed in. And then perhaps ask the committee to receive a report from Siobhan.
Yes, at least. Okay, thank you, Sarah.
I've made a note of that. So we've noted the report, and we'll look to bring in an update and a progress report in about 6 months. Thank you, Chairman.
We now work towards agenda item number 5. This is an update on the state of the independent care market in Gloucestershire and actions taken and the interim market support plan. And this is from pages 39 to 48. Sarah.
So I was trying to give you all a bit of a rest from me talking at you for 2.5 hours. So I had originally asked my colleague Jenny Cooper to come and present this to you because she's actually leading the work, but unfortunately she's had to take this week off at very short notice. I'm afraid you've got me again. So we felt, Kathy, Carol and I, it was really important to bring you an update around the work we're doing in adult social care to support the independent adult social care market. And we tend to include some of the work in the adult social care, the DAS update report, the report for information. But to bring this for scrutiny, we felt it was really important because there's been quite a lot of publicity about the pressure on the health and care system, about the challenges in social care in terms of recruitment and retention, and we've brought you updates around some of the non-recurrent funding streams in early reports throughout last year, but we found it was helpful to pull this together. So I'll take the report as read, but I'll just talk you through some of the key points. I think one first thing to highlight is that the County Council has a statutory duty to support and to manage the independent care market, and that includes nursing homes, residential care homes and domiciliary care. And we spend quite a lot of time doing that. We have a specific team that works on that. From the next agenda item, I'm joined by the head of adult social care operations, Keith Vardy, and he's got quite a large team of social workers that spend a huge amount of their time trying to support people to maintain their independence. And so most of our work is around trying to support people to stay in their own homes, perhaps with some extra support, a package of care, and then for relatively few people, perhaps they might need admission to a nursing or care home. But our job is to try and ensure that the market is there to support people at whatever place they are on their journey. And we also do quite a lot of work around supporting people to come out of hospital. But in the grand total of what we do, that's actually a relatively small proportion of our work. So the document also it has a bit of a needs analysis in it, talks about the numbers of people that we're helping. And what we do know is that we don't fully understand the impact of COVID on our population. We're beginning to suspect it's made people more vulnerable because we're seeing people coming out of hospital needing larger packages of care, perhaps more frequent care or have more complex care needs. And that's having an impact on our care market. So the report talks through some of the difficulties that the adult social care market is facing at the moment. And we have been really fortunate in the last 2 years to have had quite a lot of funding streams. I think we're just about to give our 6th different grant agreement for the 6 different funding pots to our market, which in itself is an industry to try and actually deliver and get the money out to these organisations. So we've had national support grants for things like infection prevention and control, PPE. We've had extra funding for the provision of testing to ensure that there's sufficient staff to do the whole care home testing. We've had additional funding to support staff attending their vaccinations. And these have all helped to sustain the care market throughout what's been a very, very difficult 2 years. And I think you'll see in the report, there's a quote from one of our care providers around displaying how thrilled he was to get another piece of funding through, because really recognising the value that and the importance that that's had in terms of sustaining his business. So these are all non-recurrent funding streams. And so the local picture has emerged, I think, where we are seeing some care homes who are struggling to continue to survive. And we also see on a worryingly more regular basis a number of domiciliary care agencies handing back packages of care where they simply don't have the number of staff to be able to deliver that package of care. And sometimes it's a permanent, we're going to have to hand back 20 packages tomorrow. Sometimes it's just we haven't got staff for the next 2 weeks. But that places a lot of additional pressure on our team and on the other care agencies, because we have to find those packages of care because people are at home waiting for them. So it is a really pressurised system at the moment, I think. So the issues that we're facing here in Gloucestershire, I think, are very similar to other local authorities. So I don't think we're an outlier in any way. And some of the challenges facing the adult social care sector has been well described nationally. But I think in terms of some of what's driving some of these issues, the report also highlights some of these. So as I said, we've got a higher level of demand for domiciliary care packages. Those packages are either need to be more frequent or they're more complicated. You might need 2 people as opposed to 1 person visiting that individual at home. And that's reflecting the higher level of need we're seeing in people as a result of 2 years in a pandemic. Certainly we're seeing a higher level of need in the people being discharged from hospital. It's been well reported nationally that there is a bit of a recruitment crisis in adult social care. We are struggling to attract and retain people into care. And I think those of us involved in adult social care very much see it as a career. It's a great place and great system to work in. And I think people would reflect that they can very quickly see the positive impact of the work that they do. But if you're then trying to recruit a domiciliary care worker, or perhaps they could get more money in a supermarket or in the hospitality industry, it's very difficult to try and attract and retain those members of staff. And I'll come on to later some of the initiatives that we're planning and have implemented, and also in relation to Kate's question as well earlier, to try and retain some of these really valued staff in this sector. So we know there's a reduced supply of care workers. We know that there was an impact of mandatory vaccination. Yes, the system didn't collapse, but it certainly had an impact, and staff did leave because they did not want to be forced to have the vaccination. And it's also worth noting that the mandatory vaccination only applied to care homes and the first 2 jabs. We now have the second piece of that legislation, whereby the 1st of April this year, all workers in the care sector and wider healthcare sector have to have those first 2 jabs, and we will inevitably see some exit from this sector because people don't want to have the vaccination. There was an impact due to Brexit. It might not have been necessarily immediate, but we did see, certainly last summer, over the summer holidays, quite a large number of people went back to Eastern Europe and just didn't come back, just did not return from their holidays, and that had an impact. And of course, it was packages of care then we could not fill because the organisations didn't have the staff and had to recruit. We also saw the impact of furlough, and we've seen about a 35 to 40% drop, particularly in our domiciliary care market over the last 2 years, and we're having to build that back up. But what my team tell me is that during furlough, they attracted people to the care sector, particularly those that perhaps might have been in the beauty industry, hairdressing industry, that of course closed for the duration of the furlough time. And then when furlough ended, these people went back to their jobs, perhaps because they were higher paid. Now, you can't really blame people for that, but these slight nuances to some of the policies that we're working with that then have an unintended consequence. So the range of different issues that are impacting on our system, on our care system, but collectively they do have quite a significant impact. So the paper also provides some feedback from a recent survey of a proportion of our care providers, and you can see there some of the impact that the pandemic has had. So in terms of what we're doing to try and combat this, for some years now we've had a team working on a program called Proud to Care, and there's the website link in your pack. And this is essentially how we try and promote care as a career, as a destination of choice. And we try and there's a whole range of program of different initiatives to try and attract people into the caring profession. We have an integrated brokerage team in our county. So the CCG and the County Council jointly employ a group of people, and it's their job to broker individual packages of care, whether that be a domiciliary care package in your own home, or a nursing home bed, or a care home bed. And the benefit of doing it together as a joint initiative is that we're not ever working against each other. We have one team who have an overall grasp on the market. They spend a lot of their time developing relationships with these independent organisations, with these companies, and they're able to place people relatively quickly. It's an efficient service. They've still got a waiting list because we are very, very busy at the moment, but we're not effectively robbing Peter to pay Paul. We're not offering different rates. We're not pricing each other out of the market. So the health and care system acts as one and is working jointly with the independent care sector, and we think that's working really well. And in the paper, it talks about some of the different incentives and initiatives we're trying and buy as much domiciliary care as possible. We have quite a number of care home beds. I think we've brought reports in the past, haven't we, about care homes and the work we're doing to try and understand the impact of COVID on our care market. But we're offering increased incentives. We are offering to try and offer different packages of dom care to providers, so to reduce the travel time, to make it more efficient for providers when they're spending less time travelling between different people to provide care, just to try and make it as efficient as possible. And everything we're doing, I think, I would say we spend quite a lot of time trying to sense check what others are doing across other local authorities. We're not averse to pinching a good idea and trialling it in Gloucestershire. So always trying to improve our practice and make sure we're as efficient as possible. And the last section then is on funding. So as I mentioned, there have been lots of non-recurrent funding pots. So we have had something called a Workforce Recruitment and Retention Fund. And you might have seen the news reports this week where we have actually delivered our first payment to the system. So the idea being that we wanted to give a thank you payment to the care system, to those working in Gloucestershire, to say thank you for all they've done. This was £1.73 million that came to the County Council, and we did seek some advice and talk to other local authorities as to how they are implementing this, because we're already giving out 5 different grant schemes to our providers. So how do we do this in a way that doesn't cause them a lot more work and actually get the money into the pockets of those frontline workers? So what we did, we went out to all our providers and said, we want to give a thank you payment to your staff. We mirrored other programs where we were looking at rewarding those that have been in work for 6 months as of the end of December. And so if you're full-time, you get a payment of £185 as a gross payment, and if you're part-time, you get a proportion of that. And we had 229 providers that expressed an interest in participating in the scheme. We then passed the money over to the providers, and then the tax and national insurance are deducted as it's passed to the individual. So that's going out at the moment as a thank you. We've also had a second workforce recruitment and retention fund, and we envisage giving a second and third payment in February and March this year. And really as a thank you. I think the point that Kate made around Somerset have increased the base rate of their offered to domiciliary care. We have reviewed the rates we pay to domiciliary care. We have some of the highest gross rates to domiciliary care in the Southwest. Obviously, some of that is commercially sensitive, so I won't be giving out figures in this meeting. But I think that one of the challenges is how do we, in the longer term, in order to make care considered to be a profession and a career choice, we need to make sure that we're offering a wage that is comparable with other sectors in the county. That's one of the challenges. So you'll recall in the past we've brought you brief updates on our response to the care reform, and we know there's going to be a greater ask on our care system. So one of the things we have to do this year is to conduct a cost of care exercise, and that will determine sustainable rates for our local sector in terms of how much do we have to increase hourly rates by the cost of a bed per week, for example. So the challenge that we're working through at the moment is how much can we add to an hourly rate, because whatever we can't increase an hourly rate on a temporary basis, because you can't give people more money on a regular basis and then take it away. I think what we're doing with the thank you payment is it's seen as a bonus, and we're not trying to amend the hourly rate, because we feel quite strongly that we want to do that recurrently, and we need to ensure we have the budget to do it. So the cost of care exercise is really important, and the team are just thinking through how we do that at the moment. So I will pause there. Happy to take any questions.
Do we have any questions, members, or comments? Kate?
Yeah, just,
I'm sorry.
thank you, Chair. Just briefly, did you say national insurance and tax will be deducted from that yet? And I think you said 229 providers are participating. How many is that out of? How many providers?
So we have 212 care homes. I don't know off the top of my head how many dom care agencies we have. I'd have to check that. And that also includes supported living. But we went out to all supported living providers, dom care providers and care homes in the county, and 229 responded saying they wanted to be part of this. Because they're all independent, I don't think we haven't got a mechanism to give the money to every care worker. We just don't have it. So we have to work through the providers, and the providers obviously had to want to work with us. So 229 have come forward.
Okay. And of course, that's the only way you can sort out the taxation, isn't it, as well?
Yeah, we can't do that here.
So could at some point, if it's not too much hassle, if we know we've got 212 care homes, could we know how many supported living and dom care places we have as well?
If Jenny was here, she'd know that off the top of her head, but I will find the information and I will give it to Jo as part of the minutes.
Brilliant. Thank you.
Okay, thank you, Kate. Anyone else wants to make any comment or ask a question?
Yeah, may I just ask one to Sarah? Happy New Year, Sarah, and thank you so much.
Pam.
Do. I think you're absolutely brilliant, and your team and all the work. I think you need a bonus too. But anyway, my question here is, I'm just thinking about it, like the private nursing homes. You know, you've got the Charity Trust, you've got Parkview. We do not give money to those homes, they got to. I know they are giving bonuses to their staff. Does that come out of our budget or out of their budget?
So this particular fund was offered to any CQC registered care provider. So any care home, private. I mean, we have our arrangement with Order of St John. So we own 13 care homes, but Order of St John run them for us. But most of our provision is privately run. So I think recognising that we had lots of debates about this, because of that total quantum of care provision in the county, we probably commission around 50% of it, and the other 50% is commissioned by self-funders, people that buy and arrange their own care. But everyone in the care sector has worked exceptionally hard. Whether you might be looking after a self-funder in one room and a county council funded person in another room. So you've still had to battle with COVID, the PPE, the testing, have all the stress of that. So the idea was we wanted to say thank you to the system, to those workers. So we've just said, as long as you're CQC registered, which is the dom care, nursing, residential homes and supported living, then we will issue this thank you payment. All we needed was the organisation to agree to have a grant agreement with us, and that's the only way we could pass the money. So it's a thank you to all of the system, and we've still got some money that with a paper. Jenny, who's not here today, has just produced a paper to discuss how we might allocate the rest of the recruitment and retention funds we've received just before Christmas. So trying to understand how we could best support the system, because with non-recurrent money, we can't permanently uplift hourly rates for dom care, for example, because we haven't got the assurance of the funding going forward. So it's trying to make sure that we use the money in the most sensible way and get as much of it to the pockets of the frontline workers.
Thank you so much.
Really has temporary funding, isn't it?
Yeah, thanks, Sarah.
Any more questions, members?
Thank you, Stephen. Please, could I tell Sarah? Thank you, Sarah. You mentioned about the cost of care in the sector. You're doing a piece of work on that over the next few months. Will you be coming back to us with figures on that one? And are you able to give us those figures when, is it going to be out in the domain? Will you be able to tell us those figures, what you arrive at?
So I would have to go back and check on the detail of the cost of care exercise. I think some of it might be commercially sensitive, but I'm sure we have a way of sharing commercially sensitive information with our scrutiny committees, because we do it with council and with cabinet. So can I take that away as an action with Joe? I don't think we're planning on starting it until the summer, and it's a significant undertaking, so the team tell me. So we need to find a way to ensure we can share that information with you, but I don't think it's necessarily information we would want to put directly into the public domain. But I'd have to go back and check that. Is that all right? And come back with a clearer answer.
And we could use indexing, couldn't we?
There's a whole complex methodology that I don't have quite to hand, but I think if you let me take that away as an action, I'll come back with a clearer answer.
Yes. Any more questions or comments, members?
Yeah, can I ask one, Stephen?
Terry, good morning.
Morning. Sorry I was late. My wife had got off the bike supplying electricity from the dynamo. Yeah, it was quite a problem. We keep freezing in the Forest of Dean. It's, like Stephen was, that's happening to me. And I miss what Sarah said about the one-off payment. Did you say how much that was, for the care workers? Because I've had letters come through from care workers stating about looking after them and raising their hourly rate. Is that being looked at as well? That's the second question.
So it's £185 per care worker, providing it's been open to all, providing their organisation has opted to be part of it. So I don't think all of them have, but it was certainly open to everyone.
Yeah.
And we are offering second and third payments, so we may well see with the promotion of this initial payment, other providers coming to us saying, well, actually, we'd like to offer that to our staff. So, and then it would be subject to tax if they pay tax and national insurance deductions when it goes through their salary into their bank accounts. In terms of permanent uplifts, one of the challenges is all we've been given to date, and albeit quite a lot, of non-recurrent funding. So we can't permanently uplift hourly rates to dom care based with non-recurrent funding, because we would have no way of assuring that we could continue to do that. And we think it's probably worse to give a temporary uplift in hourly rate and then take it away.
Yeah.
So that's why we're going through the process of offering the bonuses, if you like, because then that's not seen as an increase to hourly rate. I think we do have one of the more generous hourly rates across the Southwest for domiciliary care that goes to, in terms of the gross payment that goes to domiciliary care organisations. But I think we need to wait till we've done the cost of care exercise, which will hopefully give us the sort of an indication of what a sustainable rate would be for the independent social care sector in the county.
Yeah.
Everyone's got to do one of these exercises in the next financial year, and then of course we need to determine if there's the funding to follow that. But that is the next part of the conundrum, I think. But we need to do the exercise first.
Yeah.
And the cost of care exercise will, of course, establish whether there is a serious gap, won't it?
Yeah. Yes, it will.
Would that fund come yearly? You know, the £185. You know,
it's not recurrent. It's a non-recurrent pot of money. So we've had one fund that just in November, and that money's going out as we speak. And then the second Workforce and Recruitment Intention Fund is being discussed at the moment, and we anticipate further bonuses being paid in the next few months.
Thank you, Sarah. Thank you, Stephen.
Thank you, Jerry. Anyone else? It appears not. Nope. So we can then proceed to item number 6, which is on page 49. Talks about the local government and social care ombudsman investigation, which we've really recently undergone. So Sarah, if you wish to... Oh no, we're having Keith. Is Keith doing this?
So I was just going to introduce Keith and Moira, if that's okay. So
yes.
So we're joined today by Keith Vardy, who's the head of adult social care operations for adult social care, and Moira Wood, who's our principal social worker. And you recall we had a conversation about this particular issue at the last Scrutiny meeting, and that was the day before we were taking a report to Cabinet about this. So I gave you a bit of an update. I think some of you might have seen the Cabinet report at that point that was in the public domain. So the report before you today talks about an investigation that the local government social care ombudsman conducted into a complaint brought by Miss X and Mr. L into some of the processes and the treatment they receive from adult social care. I think, as I said, in November, this was not an indication of our usual standard of practice. We have apologised profusely for the care and the experience of both Miss X and Mr. L, and we have agreed with all the recommendations made by the Ombudsman. The report before you today talks about how we have fulfilled those recommendations and how we wanted to go above and beyond the recommendations made by the Ombudsman to assure ourselves that this was an isolated incident. So you'll see attached a report, what we call the Critical Friend Report, from Moira's equivalent in a neighbouring local authority, who very kindly came in and did some work with us on our systems and processes. So I don't know if there's anything more to say, but I've asked Keith and Moira to join us because they're the ones that have led this work and have got an in-depth knowledge of it, so are probably better placed to answer some of your questions.
Okay, members. Kate, you had some questions about this earlier, didn't you?
I didn't, but I just would like to say very briefly that when we first got the report, obviously these things happened in 2018, 2019, and it was really good to see that a lot of change or whatever was already in place. So congratulations for that. I mean, it's a terrible situation, and these are very important reports, but also very in depth, and it's good to see.
Yes, indeed, thank you. And as you can see, the next the ASC Operations Action Plan is follows on from the recommendations in the report and gives almost a timeline of how those recommendations are in fact being dealt with. The greens are complete and the yellow are in progress. So if anyone wants to ask any questions, please feel free now.
Keith or Moira, did you want to add anything at all?
Only, thank you. Only just to say hello, everybody. only just to say that the recommendations that you've just referred to, Chair, are in relation to the independent social worker report from South Gloss. So all the recommendations that the Ombudsman have made are complete.
That's good.
I think Lisa would like to ask a question, Chairman.
Lisa?
Thank you, everyone. I'm just interested in sort of unpicking a little bit of this from a sort of from the point of view of just, you know, how do these things happen? And there's been a few cases actually in the media recently where, you know, it just sort of defies belief that these things really happen. And I just wondered, you know, Keith, Moira, whether you could just unpick and help us to understand, because obviously everybody who's involved, I would hope, in adult social care does it for a good reason. And it just seems that from the Ombudsman's report, it just seems that time and time and time and time again, that this woman's doctors and experts were ignored. It just, that came across quite strongly in the Ombudsman's report. And I'm just wondering, you know, how this happens, and from your perspective of being on the ground, just how this can happen. And I, you know, I appreciate you've obviously put in actioned all of the recommendations, and that's brilliant. But just could you take us back a little bit, just so we can understand how this happened?
Yeah, certainly. It's a very good question. Looking at these things retrospectively, it's often very difficult to understand what it was like at the time, and that's certainly something that I felt when I did look into it. And as you know, a number of us have pored over the documents available, spoken face to face with those individuals that are still here and do recall what took place at the time. And I have to say, not everybody is still within adult social care in GCC. Some people have moved on. Some quite key people that were involved. So, I haven't been able to talk to those. I think it's in part about the situation that the team found themselves in, with a very, very complex scenario, with a very, very complex lady. And I think they lost sight, if I'm honest, of what they should have been doing. They got wrapped up in challenges that actually didn't help them maintain their practice, in terms of challenging things that were not really relevant. It wasn't really their place to challenge, let me put it that way. And I think that then a reputation was formed within the team. I think people were worried about it. I think that a number of people were involved, too many people. One of the main ways that we work now and seek to avoid is what we call handoffs. We don't want to be passing an individual from one worker to another. That's how mistakes are made. That's how information gets lost. And equally, it's not an efficient way of working either, or a person-centered way of working. And I think, as you've alluded to, we've changed our practice since then anyway. Not because of this, we were doing that anyway. We now work in a much more strength-based way. We ensure that all of our staff are regularly supervised, both formally and informally. Individuals are talking about the people that they're working with at least once or twice a week in what we call hubs and huddles. So I would be confident that those issues, those mistakes would not happen now. They would be picked up at a much earlier stage. And as I say, looking back retrospectively now, 3 years later, I think that people really did, as I say, they lost sight of what they were trying to achieve here. They were worried about making mistakes. They were under almost constant challenge from the individuals that they were working with. And there were far too many people involved. And I think lastly, what I would say is that the worker that was working with this lady, majoritively, was working outside of a team at that time. So she wasn't under the direct oversight of a manager within a team, and that was a mistake. I'm not able to identify now why that was the case, but I absolutely can guarantee you that that is not the way we work now. It would not happen now. No workers operate outside of a team structure. Does that answer
really
your
helpful,
question?
Yeah, that's great. And I know that, you know, hindsight is always 20/20 vision, isn't it? And it's very easy to spot the mistakes looking back. But thank you for your honesty in answering that question. It's much appreciated. And also it's good to know that, you know, you've recognised these issues and that, you know, you think there are safeguards in place. Obviously, you know, things happen in life. No system is perfect, but it's very reassuring to know that you've taken this so seriously. So thank you for that.
Thank you.
And if I may come in as well, just to kind of add, I think it's been added reassurance to have the independent principal social worker draw those same conclusions, to see the strength of our model, and particularly to see the level of oversight that there is now for individuals' work. And as Keith has alluded to, actually we do believe that anything like this would be picked up far sooner and be able to be addressed very swiftly. And I suppose I also want to reflect on the way the workforce have responded to this as well. You know, we've had very high compliance with them attending the Care Act Refresh training that we've delivered to them, and people recognising and being disappointed in seeing, you know, that failure in practice and being committed to enhancing their own practice and not allowing this to happen again. So I'm very confident that we have a learning culture within adult social care, and that's really been evident to me throughout this.
Can I just say, how long had this working outside of practice been going on for?
From what I can tell, it went on for a period of around 3 months.
Is that all?
Yeah, that's all. Yeah.
Thank you. That's interesting. Can I ask another question about that? What caused it to exit the system?
I understand that at the time there were some performance concerns with the worker, and so she was temporarily removed from the team that she had been working in. Right.
And how long had that person been employed by the county council?
I don't know the exact number of years, but it was a number of years. It was
years?
Yeah.
Thank you. Do we have any more questions, members? Well, I think it's obvious when you read the papers here that this has been gone through with a fine-tooth comb, especially from the report from the external critical friend, worked very well as looking at the operations plan, and that's still ongoing, Keith, isn't it? Sorting out the amber.
Yeah. Yes, it is. There are a few recommendations yet that we're you know, still waiting to fulfil. Some of those are dependent upon our IT system, but we are certain that we will be there at the latest by the end of March. We will have completed all of those.
So by the end of the first quarter, all those different coloured boxes will be green.
Yes.
Okay, thank you.
Would it be useful, Chairman and Keith, maybe to bring another progress report on the action plan later in the year? Would that be something?
I think it would be vital that we receive a follow-on report.
Okay.
I'm very happy to.
Yeah.
Thank you very much.
We'll pop that onto the on the work plan, and we'll bring another update report later in the year.
Yeah, thank you. And now we come on to item number 7. If anyone has any last-minute questions, Chief Fire Officer's report, and that looks like item number 7, isn't it?
Yes, and that's Mark. Mark, do you want to present your report?
Good morning, Chairman. Good morning, councillors. Perhaps before I get into my report, if I just quickly cover on the previous action sheet, there were a couple of items for myself to cover. One was to do with bogus callers, and members requested additional details regarding the packages to support the public with bogus callers, and that's been sent as an email. There was also a further couple of actions to do with bringing future presentations to the committee, and those are scheduled to take place in June and May to give an update both about flooding and some of the work that trading standards do as well in a bit more detail. So those items will be dealt with in due course. But turning to the report, first focusing on trading standards. I appreciate councillors will have read the report, so I'll just pick up the key areas really and glide through it. One of the key areas for trading standards to focus on is around protecting consumers from unsafe products. And in that respect, there is quite an extensive regulatory regime that exists to cover all types of products, but mainly those that are intended or reasonably foreseeable where there's a potential danger around vulnerable people, particularly around electrical items and play items as well. With product safety being a priority area for the department, and we work closely with the council, particularly public health around the toxicity of products, and also with fire about prevention in the home, because some of those products, as I'm sure you can appreciate, pose a fire risk. We have 2 dedicated members of the team who have a specific responsibility for product safety, although all members of the team can actually undertake those activities, but 2 people focus on it solely. And we have a wide range of powers, from demanding information to actually having the ability to suspend or prohibit the selling of products, which is what we do in the worst case scenario. What you'll also see at the bottom of page 1 is in certain instances we also act as a backstop, and that's where perhaps a product needs to be recalled by the manufacturer and they're not able to do so. We step into that role to make sure those products are removed from the local consumer. Turning to page 2, you can see that majority of the complaints or work the department undertakes is in respect of complaints, both from local residents and also from businesses. And in that area of work, we link with the Office for Product Safety and Standards, and that department falls under the Business, Energy and Industrial Strategy Department. And they occasionally or periodically release guidance on various products that we ensure are followed up within Gloucestershire. What you can also see as you move through page 2 is the number of items that have been removed and the type of items that we've taken intervention in, which when you add them up, it comes to approximately 22,000 unsafe items or non-compliant items have been removed from Gloucestershire. And the value of that, as you turn over to page 3, is a staggering £732,000 worth of product. One of the themes that we've picked up during the pandemic, though, is that it has created a growing cottage industry where people are working from home and selling products using the internet and social media. Now, this does pose a problem to the trading standards team because it's very difficult to detect and monitor and police. But it's an area where we will focus on, and we work with local businesses to pick up trends and obviously with local residents. What we do understand, though, is that with our local intelligence, what we see is probably only a fraction or the tip of the iceberg of what is going on in the local economy about people working from home and setting up businesses. Where we have to be particularly vigilant is around those type of products which have the potential to cause harm, whether they be electrical or toys or products, cosmetic products. Because what many businesses fail to understand is there is a particularly strict regime around technical files, safety products, and also rigorous testing regimes that these products need to undergo before they enter the market. Another growing trend of problems that we're seeing is about the importation of goods into the UK. Obviously, with their status changing from leaving the European Union, one of the rings of defence in the past was the European Union would vet products. What we're finding happening now is that somebody might order a product via the internet, and that's coming direct from the manufacturer in China, and not going through such rigorous import testing as would normally be the case. The other areas of work that we cover is that trading standards are responsible for explosive licenses, particularly fireworks. We also cover petroleum storage, where decommissioning of petrol sites are removed as well. And we also deal with illegal tobacco. This is one of those areas, if I just link that to the issue with fire, is that illegal tobacco often hasn't got the inhibitor that once if you like, a cigarette is discarded, it's meant to self-extinguish. It's not meant to continue burning. And that's an additive that's added to the tobacco by appropriate manufacturers. What happens with illegal tobacco is that inhibitor is not added. And so a cigarette that's placed on furniture will continue to smoulder and burn, and hence you've got the risk of the public and the vulnerable. So a key area that links into obviously fire. If I perhaps pause there as well, I don't know if there's any questions on the sections I covered, Chair, and then I'll carry on with the rest. No, I've seen no hands raised, so I'll carry on. The next area relates to trading standards, and I'll just touch on the performance figures that were also attached to the report and give you a bit more detail around a couple of the key areas. Our budget remains on course, and where we have had a predicted underspend, we've used that to bring in additional staff to put capacity into key areas around food standards and also carry on work on product safety. One of the areas I've picked up from the performance indicators of concern is about inspection figures for high-risk food premises, and that remains below target. Our target's 55%, and we've achieved 7%. We've recognised that our inspection strategy needs to change because most of these properties, or businesses, I should say, operate outside of normal core hours. They operate in the evening because they're food outlets, and it's about the training standards team being available in the evenings to make sure that the way the products or the food is advertised and sold is correctly displayed. So, for example, where people have got allergies to nuts or other types of product, it's about those products not being present in the item that's sold. Another area of focus that we've talked about previously has been the management of scam and doorstep crime, and that is about victims feel better able to withstand future attempts. The target is 80%, and at the moment we're achieving 53%. And some of that work is come about, and it links into the point that Sarah made earlier when she was talking about care in the community. These are often vulnerable people. They feel very isolated and lonely, and they fall sadly prey to these type of schemes, but it takes a lot of work to make them feel confident and secure in their home again once they've been targeted and fallen a victim to it. So that work will be ongoing, and hopefully that performance figure will improve. An important thing to note as well is that trading standards are in the early stages of engagement with the Gloucestershire Police around victim support, working with other voluntary sector organisations to establish a multi-agency approach to supporting victims. What you'll also see on page 5 and into page 6 is the key legislation. It's quite a raft of legislation. Trading standards are responsible for enforcing and policing within the county. And that covers trading standards. So if I just pause there about trading standards to see if there's any questions, I'll then move to civil protection. So I can see Kate has raised her hand, Chair.
Any questions, members? Kate has her hand up.
Chair, thanks for the report. Interesting as ever. I never sort of thought that I'd be really interested in trading standards, but I do actually find it really interesting. So thank you. I just wondered, I mean, you've mentioned it yourself really, but is it time really now for trading standards to change, to shift to some out of hour employment? Like, for example, I mean, the police do it, don't they? Doctors, nurses, the mortuary, we've read about, they're doing weekends and things, but, you know, supermarket assistants, etc., etc. Is it time for perhaps a member of staff who, you know, to be employed specifically out of hours in order to cope with a lot of these takeaways, which are, as you say, out of hours? Is it time for the whole, you know, thing to shift, basically? Yes,
and on your point, Kate, which I absolutely agree with as well. The team are flexible. I think it's now about increasing that flexibility to do more targeted activity in the evenings, which is what they're recognising. So hopefully in the next quarter, they'll have geared up their activities around more evening inspections and visits to make sure they target those premises.
Thank you.
So I think if there's not, oh, sorry, yeah, was there another question? I can see Pam, you've raised your hand.
Sorry, I had to come out and come back in. It keeps sliding down. I'm having trouble with my chairs too here. What it was, I'm going back to, and I think that's a great question, staggered hours. I believe that in everything now, that, you know, to bring people out in the evenings and start later in the day. But going back, fireworks. I clicked on. I know that was before. So what control have you got on fireworks? When I'm driving along now, I see lots of notice on lampposts and that's saying you get your fireworks from here. And I'm a great believer in trying to stop and get organised firework displays, because they seem to be going off day and night, and I feel sorry for all the animals, like the horses in the fields and everything else, and for the old people and for everyone else. And I don't know if I should say it on here, but I'm going to say it anyhow. And like the refugees and all that comes here, when they hear a bang, they're frightened to death. And I don't know how we can control all this. And does that come under your portfolio? You've got a lot on, haven't you?
It does, Councillor, yes. In terms of trading standards, what they enforce and under the licensing is about that they're correctly stored, that they're sold appropriately, not to children, you know, that people have to be over the age of 18, and they do testing marketing as well to make sure that products are only sold to over 18s. So it's about the storage, it's about the quantity is an important figure as well, about the quantity that's stored. And obviously, as you'd expect, they get busier towards the autumn with bonfire night, but actually fireworks are used throughout the year with different communities celebrate births and other religious events using fireworks. On the wider point, I would agree, actually. I think licensed events would be the best way for fireworks to be used because of the risk they pose. If they're used responsibly, then, you know, they're a great thing and a great event. Sadly, unfortunately, too many youngsters and, as you say, animals are injured with fireworks.
Oh, it's terrible. So is there any way this committee or you, another burden on it, that we could try and enforce this and have a meeting or a motion put forward to the council to set an example or whatever? You know, it is a lot to control. I think it needs a task force group or something. Well, that's up to you, Mark. But what do you think, Chair?
Well, I think, yeah, I mean, fireworks out of season, as it were, are a danger. And we must, I think that they have to all to be licensed. But then again, you're talking about the difficulties of enforcement. But we should start with talking about licensing all the sales of fireworks.
Yes.
Or the purchase of fireworks, whichever it is.
My point is, it does affect older people as well. Like, you know, and it is sad sometimes that people shut themselves in a cupboard and they don't know when. And then, you know, when the fireworks going off, and then especially with these old people, with more mature people, with their little dogs, and the dogs. One lady roundly said the dog was running up and down the wall. Well, it's a good dog to do that, but you know, they're so frightened, and they got to calm them down. You know, and that's you know, it is good on their mental health. But, you know, it would be nice if someone we could take this to full council and do something.
I think, Councillor Tracy, I think with the licensing, I think this is local authority, isn't it? Is it district licensing committees? But if you want to raise this at full council to try and push something through, but it is legislation, and it would be a huge start, you know, a huge task to take this forward, but it could be something that you could put out to the district authorities in a message.
Yeah, it's just
can we have a conversation later about the licensing of the sales of fireworks?
I think when trading standards come back and give an update on one of their presentations, that could be something I get them to focus on, to give you a broader picture of the work that's around fireworks, and that will inform the approach you take in the future.
And I think, Mark, we've earmarked, if the committee, we were going to mention this in the work plan, but we're looking under Mark's report to the committee that trading standards come to the committee meeting in July to give a presentation, a more in-depth presentation. Is that correct, Mark?
That's right, yes. So we can pick it as a
if we could, theme that topic into that presentation, would that be acceptable to you, Chairman? Pam?
And I think Mark and I will have a conversation before that time.
But also, as an adult, you know, the committee we're talking about, we got the Queen's celebrations coming up. My God, there's going to be some fireworks going off there, isn't there? So I think, you know, we could set an example. But yeah, it's up to you guys.
And the lighting of beacons on the 3rd, I think the 2nd or 3rd of June. So I think, Mark, I'm hopeful that the the lighting of beacons is being sort of streamed, that there are reports of where the beacons are being lit, and that the police and the fire authorities are being notified. So I think that is in hand.
Okay, thank you.
Thank you.
Chair, I think Kate's got her hand up as well.
Thank you. Yeah, I just wanted to say to Councillor Tracy, if you want to bring a motion, I would happily second that. And I fully support what you're saying. I think we need changes in the law, and we perhaps should lobby our MPs. I get lots of constituents writing to me around fireworks, particularly firework night, but around that season. There's the environmental impact, of course, as well, and the danger impact.
Yes,
as you say, animals, domestic, but also farm animals and wild animals. So
people who's come to our country away from it, and they've
got traumatic syndrome. Yeah, absolutely.
Could I suggest then that we have the report, that more information is presented to the committee, and then a decision taken after that? Would that be helpful to just get a better understanding of what the licensing is? Yeah.
But you would take it on, would you, Mark?
Yeah, fine. Yeah, I'll bring that forward in the presentation to give you.
Can we do that in a month, Mark?
Well, Joe was saying, I think the presentation by training standards is June or July. They're coming forward.
Yeah, July meeting, Chairman. We've got that.
Is that before or after the Jubilee celebration?
It's afterwards. Yeah, maybe we could use the Jubilee celebrations as something that we could work on. I know that that's being organised nationally, so there is really nothing that we could do locally on that one, other than to make sure that we are doing risk assessments, and that is being done. Any beacon or any event must have a risk assessment, and that is being reported to the police and to the fire. So my suggestion is that we have an informed report as part of the presentation to the July meeting, and then the committee can sort of make an informed decision from there.
So, Chair,
Mark,
thank you. Chair,
do you think is that a timely situation, or will we be a bit too late?
No, I think we can work to that timescale, Chair, and then obviously if the that information can then be, if you like, used to what councillors write to the local MP to support the argument about better regulation of fireworks, if that's what you feel is appropriate.
Okay.
It's not people writing to me. They ring me when they're going off.
But potentially, Chair, outside of this, I can speak to Joe, and if you'd like that item brought forward, I can work with Joe about the agenda to see if we can bring the presentation forward.
Yeah.
Happy to work on that outside of this.
I think, well, can we have a conversation outside of this meeting about bringing it forwards?
Yeah, no problem, Chair.
Thank
I'll
you.
do that. Okay, moving on, if councillors are happy to move into civil protection, on page 6, there's an overview of the activities that have taken place in the last period. Just key ones to note. The civil protection team have helped with 5 temporary accommodation requirements for displaced persons following either fires, explosions or structural damage. We've also dealt with support to a care home through prolonged power outage following Storm Arwen, and they're also providing support to the City Council following the recent cyber incident. Coming towards the bottom of page 6, in terms of business continuity management, a CLT have agreed a 2-year project which commenced in October 2020 to strengthen the business continuity framework across the County Council. The work is already ongoing across this to make sure that our processes are fit for purpose in terms of business continuity plans to deal with such things as power outage, loss of fuel or power. What you can see as you turn over to page 7 is that the business continuity plans have been delayed to a degree, and I think that reflects really the work that's been going on around COVID, and departments within the council have been heavily involved in supporting local communities and vulnerable members within that community, and I think that's led to some of the delay, but that work is now being picked up in earnest. What you can see at the bottom of page 7 is an outline of the district council service level agreements and the support the civil protection team provide across the districts, which is quite far ranging, as you'll see from the areas listed. And then turning to page 8, just to pick up about the support and the work they do with the Local Resilience Forum. CPT sits on one of the subgroups around community resilience. They've now finalised the plan template and guidance around community resilience plans based on central government guidance. They're also supporting the LRF Human Aspects subgroup, which is working with the Health Resilience Board to develop a framework to do with psychosocial support for persons affected by an incident. To keep this work on track, there's a project management board that stands, and actually it's currently working on an area of particular interest to councillors, which will be around flooding and community resilience. This is chaired by the Environment Agency and brings all the flood planning, support and response under one area of work. CPT represents on this group along with the County Council, and it's been a particular area of focus, as Sarah will know, with the local MP as well. This has been raised on that scale as well. On page 8, you'll see an outline of the plans that work is currently ongoing. One of the pieces being a multi-agency flood plan has been reviewed and submitted to DEFRA for assurance, and we're awaiting feedback. So turning over to page 9, what you can also see there is one of the key themes of work that's ongoing at this point in time is the emergency management framework. That work started in October 2020 because as a county council we are a category 1 responder under the Civil Contingencies Act, and as you would expect, communities would wish to see the local authority being visible and to provide leadership during these type of response events. What you have is a guidance document that was originally produced by the Ministry for Housing, Communities and Local Government, which is now the Department for Levelling Up in Houses and Community, and is a good practice guide for chief executives. As you turn over to page 10, what you can see that's contained within that guidance, it sets out, if you like, a roadmap of work that needs to be put in place to give that resilience, and you can see whether that work is developing or whether it's established to give you a benchmark as to how developed that work is ongoing. Turning to page 10, if I perhaps pause there before I go into coronial services, if there's any questions on CPT, Civil Protection Team.
Any questions, comments? It looks like not.
Mark, I hate to ask you this, but we've got a little bit of an issue because of timing. Could we come back to, have we just got one more section of your report to look at?
Yes, and I shouldn't think coronial services, coroner services will take many minutes at all. I can just,
we've got a couple of people who are going to present with the next item, and they need to leave by midday. So if we've got questions on any of Mark's report, we can come back to that. Would that be okay?
Okay.
Yeah, not really.
Yeah.
Okay, if I just quickly cover coroner service, and obviously happy to take questions later. Coroners is now fully open for coronial inquests. We're starting to deal with a backlog of work. One of the principal risks that the team are dealing with really is the availability of pathologists. One of our pathologists has recently moved to a neighbouring authority, and we're now looking to secure a permanent member of staff. We've got somebody who's prepared to do it on a daily or 2 days a week basis, but we'll look obviously to replace that capacity full time. And just to mention, one of the key performance indicators for the coronial services is between referral and autopsy should be 7 days, and during December we achieved a 97% success rate of achieving that. So I think that demonstrates the excellent work the team are doing, and that really covers the 3 areas that I'm the director for within community safety. So hopefully that gives you a good overview.
Thank you, Mark.
Thank you. Chairman, would it be okay if we come back to Mark with any questions and just ask Sarah and Katie and Una to just give a little bit of an update on the public health report.
Happy to return. I can't see a problem there.
Yeah, we will come back. We will come back, members. Sarah, do you want to take it forward from for agenda item 8?
Thank you. Just to briefly introduce Katie Hopgood, one of the consultants in public health in my team, and Una Wilson, who's joined us from Gloucester Health and Care. This is in response to the committee's request at the last meeting for an update on the inequalities work that we've been doing as a county to support the uptake of the COVID vaccination. So I've asked Una and Katie to come along to give you a brief overview of the work that's been going on. So I'll hand over to Katie and Una. Thank you.
Thanks, Sarah, and thank you for inviting us. So just also going to introduce Caroline Smith, who's on the call from engagement team at GCCC, who's been a big part of this programme as well. So I know we're slightly tight for time, and so thank you for inviting us. I do have a couple of slides to share, so I'm just going to try and do that now. Has that come across to everyone okay?
That's fine.
We can see that. That's lovely.
Brilliant, thank you. And I'll just pause my video to stop some. I can see I'm already starting to lag here, so apologies. Okay, I can't see how to do that, so I will just carry on. Okay, thank you. So you're probably familiar with the programme through your own experience in Gloucestershire, but the vaccine programme has been running since December 2020, and first delivered to care home staff and residents, and it's been sort of rolled out at pace ever since, really. So today, almost 90% of the population in Gloucestershire has received their first dose of the vaccine, and 70% of those have then gone on to have their second dose and their booster as well. So really incredible uptake. Gloucestershire is frequently one of the best performing systems in terms of vaccine uptake, but not just for the general population, for certain groups as well, which are at risk of lower uptake, such as those with a learning disability and carers as well. So despite this, Gloucestershire is not immune to having pockets of lower uptake, and to try and help to sort of reduce that and the impact, we've had a vaccine equity group in place from the beginning of the programme, and that's got key stakeholders from Council, VCS, Inclusion Gloucestershire, and others at the table there to try and mitigate against any potential inequalities in uptake, and that's chaired by Paul Roberts at GHC. Okay, so as I said, let me just try and change slides a second. Apologies.
Try the page down button, Katie. On your...
Thank you. Oh, brilliant. Okay.
No problem.
Thank you. So to offer some assurance about how that takes place, the group will monitor data and listen to feedback from communities and also national data as well, because not everything is in the data. We have to use some insights from previous vaccine programmes and other information to identify potential inequalities in uptake. So the group will use that information, and Caroline and Una will talk a bit more about some of the interventions and programmes that have been put in place to try and address that. But we know broadly from other vaccine programmes that there tends to be a huge number of reasons why people don't take up the vaccine, and they tend to fall within these sort of three key areas. And the first one is around confidence in the vaccine. So how safe is it? Has it been tested? What's individuals and communities' trust in the healthcare system delivering that vaccine? And so many people might want to take a bit of a wait and see approach and come on board as the vaccine programmes have been rolled out. And that's been especially true with the new vaccine, such as the COVID-19 one. The second one is around convenience. So how local is it to individuals? Can they walk in if that's their preference? Can they book if they need to be organised? And not just that, but the impact of having their vaccine as well. So we've done a lot of work with employers around ensuring that they can sort of encourage uptake in those they employ by ensuring that if they go to an appointment, they're getting paid leave to go and do that, or if they're experiencing side effects, they're also getting paid sick pay as well, so that there isn't an impact on them of going to get the vaccine. And again, when attending for the vaccine, it's about those reasonable adjustments in the setting as well. Is there a quiet space? Is there someone to talk to about any concerns? And is there information in other languages, etc.? And then the third one's about complacency. So individual and communities' perceptions of the risk and benefit of the vaccine and of COVID infection as well. And that will depend on a variety of factors, such as individuals' experience and exposure to COVID and how risky they perceive it to be to themselves. And we've seen that with very, very high uptake in those that are more clinically vulnerable to COVID-19, and then potentially dropping off when we're getting into age groups where people might perceive they're less clinically vulnerable. And then there's different motivators for having the vaccine. So wherever possible, the programme tries to anticipate any potential inequalities in uptake and try and put action in place to stop that happening in the first place, such as Gloucestershire Health and Care Trust's outreach to those that are housebound. But then through the vaccine equity group, monitor the data, listen to communities, and then try and think about how the programme needs to be delivered differently to try and address any of those inequalities. So I'll hand over to Caroline to talk a little bit about the engagement work that's taken place with local communities.
Thanks, Katie. If you could move Next slide for me. Lovely, thank you. So as Katie said, you know, the starting place is obviously our data and some of the local intelligence that we already have. But really, I've been leading a comms and engagement work stream that has been focusing on how, as a system, we can develop those trusted relationships and build new relationships within our community. And often the innovation then really comes from the community themselves. They know their community best, and they know the most appropriate ways that we can reach out to people, whether that's through linking with some of the local community champions, providing information in alternative formats, and or just sort of having a local outreach clinic somewhere close by as well, which Lena will talk about in a bit more detail shortly. And so we've been really working with partners to co-design those solutions and ensure that we really understand the complexity that Katie has already mentioned. Really, there are lots of reasons why people have chosen not to have the vaccine. And it's really just understanding the nuance of that so that we can work with them to ensure that they can make an informed choice. If you could move on, please.
Sorry, Caroline, I'm trying.
No, that's okay.
Is it not moving down with page down?
It's not.
No.
Sorry. Oh, there we go. Thank you.
Well done.
Okay. All right. So obviously this has been a developing piece of work over the last 12 sort of 14 months, and in the early stages, working with Healthwatch and other voluntary sector organisations, we did do some online surveying to try and understand some of that nuance. We've used the COVID-19 local NHS pages to really have those as a kind of hub for all of our information around the vaccine programme, and we've translated that information into some of our most commonly spoken languages in Gloucestershire, and we've worked with the Gloucestershire Deaf Association to provide materials in BSL as well. And as I've mentioned there, sort of working with community leaders, so some of my colleagues have been doing local radio interviews, and we've tried to ensure that we've got materials and sort of frequently asked questions, information in different languages and formats. Social media has been a real key way of delivering those messages through the pandemic, and actually being able to provide really short, sharp videos that are easily to share through some of the local WhatsApp groups. We found that's really had some good impact. And when we've been talking to people who have come in either to our outreach clinics or indeed through our primary care network hubs, they have told us that they've seen the information on some of those social media pages. So we know that we are reaching out to the right communities. And then very much some of the areas that we've worked in, it's about providing those drop-in clinics where we have the time to really spend with individuals, understanding their own circumstances, providing that reassurance, and actually providing those in a very local community. And some of those have been through people that we've contacted, but equally some of the examples you've got there where actually people have come to us and asked if we could support a local clinic for them. So I'm going to hand over to Una now, who will give you a little bit more detail about the actual on the ground work.
Good morning, everyone, and thank you very much for inviting me to come and speak to you. So I'm Una Wilson, interim COVID Mass Vax programme lead for GHC, and I'll just wait for Katie to drop down the slide. Yeah, brilliant, thank you. So as Katie and Caroline both said, we're working in collaboration with our colleagues within the wider system, to engage with local communities and networks to hold pop-up clinics in areas of low vaccine uptake. As previously on the previous slide, we have held clinics at various locations across the county. For example, YMCA in Cheltenham, community centres, Go Outdoors. The team were at the night shelter in Gloucester last night. We're also had pop-up clinics at food banks. Also, we're developing a project with Waterwells to offer vaccination in the custody suite and that of asylum seekers. And since mid-December, the GHC Mass Vax team have been actively involved in supporting the national booster campaign rollout. We've held a number of pop-up clinics. We've vaccinated just under 600 people. Of those, 138, 23% were first doses. And the team also continue to support vaccinations within our community hospitals and mental health inpatient units, supporting vaccinations and working with our homeless healthcare team, our mental health and learning disabilities team, as well as continuing to support the rollout of the 12 to 15-year-old programme. As we completed the first round and the second round, we're now working with our school-aged IMS colleagues within the Trust to hand over the second round of vaccinations to our colleagues. And for instance, yes, we also continue to support our housebound patients. For instance, we've been contacted by our complex care home team regarding some housebound patients who have been unable to access a vaccine, and this may have implications for their ongoing care arrangements within residential and nursing homes. So we're working with with colleagues in the wider organisation. And for instance, yesterday we had 3 teams out and we visited 3 special schools, vaccinated 25 children, half of which were their first doses. And today we are doing a pop-up clinic at the University of Gloucester who've contacted us regarding, sort of vaccinating students as they return back to university. So Katie, the next slide. So just to give you an example of a case study, on the 28th of December, we held a pop-up clinic at Kingsway Community Centre with support of the military colleagues who were in supporting the booster campaign within the county for in between Christmas and New Year. So I attended the session with this session was done under the national protocol. So I was working with colleagues from the Royal Medical Corps and also from the Marines. We vaccinated 95 people, 16% were first doses. And just to give you a little bit of anecdotal sort of experience of people who attended, one chap told me that said, how can I ask my kids to do something I haven't done? So we've come here as a family to get our jabs together. And then another, and that was a family of 3, and it was all their first doses. So father and 2 teenage children. And second quote is from a 24-year-old chap who said, I just moved to Gloucester a few months ago and not registered with a GP yet. Didn't think I'd be able to get a jab if I wasn't registered with a GP. Heard about the clinic on Facebook, so thought I would come down and ask if you could give me a vaccination. Now, with the outreach work, it's quite difficult to plan for because you don't. The Pfizer vaccine is actually quite a fragile vaccine, so we don't want to move too much of it around, and it needs to be maintained within a cold chain, etc. So, during this halfway through this session, I actually had to return to base to get some more vaccine. We had people queuing round the block, and it was very well received, and I was very welcomed the support of the military colleagues. And yes, so that was just a quick case study of one example of our pop-up clinics. But I'm happy to take questions at the end after Katie and Caroline have finished the last few slides.
Thanks. This is the last slide now. And so I'll let Caroline, if you're happy, just to quickly run through these, and then it leaves a few minutes for questions. Thank you.
Absolutely. So I think as a team working on the whole sort of equity programme, we've recognised that we have done things differently during the pandemic, and that's been driven obviously by need, but also the speed that we've had to deliver the programme at. And so what we're really keen to do is ensure that the learning from that experience is shared and used to inform some of our other outreach programmes in the county going forward. So these are just a few bits and pieces, that we've kind of picked up and really focused on that have helped us to be successful with the programme. And these are all things that we've already touched on, but I guess it's really that sort of detailed work with communities, in communities, taking time to ensure that that people feel feel safe, but also can ask us questions. And that sort of bespoke but flexible approach to co-designing services, the solutions rather, with our local community. And that last point there certainly is that we shouldn't ever underestimate the skill of our local vaccinators, and as it says there, the art of persuasion, because that's been really key at reaching some of those more difficult groups. There's still work to do. We haven't cracked it all yet, and you know, we're still looking for new and fresh opportunities, and I think we've certainly got plenty to be keeping Una and the team busy for the next few weeks, with lots of other additional sessions booked in. But yeah, happy to take any questions.
Do we have any questions, members? No?
Yeah, absolutely.
Councillor Cody.
Kate?
Councillor Cody.
Thank you. Yeah, I want to just give a shout out to the Devereux Centre in Tewkesbury. I think they have been absolutely incredible, and I'm sure that's the same in other places throughout. Huge praise to them. Couple of things. Sometimes we as councillors still don't know about last minute drop-in sessions. I know that there is sometimes we get a link and you scroll on that, click on the link, scroll down, and it takes me ages to get right to the bottom and find there's still nothing in my area. So I just wondered if that could be improved, if we could have a sort of the 6 districts, so you can click on Tewkesbury or Gloucester, and obviously if you, and a note at the bottom, if you live on the border, it might be easier for you to go, you know, you might live in Bishop's Cleeve and it's actually easier to get into Cheltenham than Tewkesbury, but that would be really helpful. But when I did have the information that there was going to be a local drop-in centre, I did share it, and it was really, really well received. There were a lot of people that were very grateful and took it up. I just wondered one thing, if there's anything we can do about any myth busting. So I know not a lot, but I know some people who didn't want to take the vaccine. They were worried about pregnancy and about becoming sterile. That was one of the myths. And if there's any information now on people who have had the vaccine and become pregnant and not had a problem. I mean, I know there's obviously a time factor there, and but we have been going for a while now. So I wondered if that would be a help, because I do have a neighbour who still isn't vaccinated. Her husband won't let her because they're concerned about her becoming sterile and wanting more children. Thank you.
We have a list of FAQs.
Yeah, so the COVID web pages that I've mentioned do have an FAQ section on them, which have got those questions, and that's the reason that you've mentioned, to try and sort of do that myth busting. Pregnant women actually is something that we've been working on more recently. We have developed a vaccination in pregnancy leaflet that is being shared widely through our community midwifing teams, and is also available online as well. And that does talk obviously about the COVID vaccination, but also the flu vaccination and whooping cough as well, which are the other sort of major flu programs during pregnancy. But yes, it's a really key point, and something that we're continuing to kind of plug away at. We have got an online Q&A live actually that's being hosted around maternity services and being promoted, and we've done quite a lot of work with our Maternity Voices partnership to try and again do some of those short clip videos, and that's, we've used some of the women who are involved in that partnership, but also some of our midwives. You're right, it's quite difficult sometimes to reach appropriate patients, and unfortunately nationally some people who have spoken out have then been subject to some of the sort of the poor social media activity that we all know unfortunately does go on. So we just have to be a little bit mindful of that and careful about ensuring that we protect anybody who's keen to speak up. But certainly one of the methods that we've used. the video clips that we've done with some of our community leaders are also on that website, and so I can certainly make sure that's circulated around. But if you actually Google COVID-19 gloss, it does come up at the top of the list anyway. So it's quite a well-used site. We know that we're getting several thousand people through that on a fairly regular basis. That's been established. And thank you for the feedback around the list. It's been an ever-changing kind of picture as we add more and more clinics in, and I appreciate it does get a little bit unwieldy, so I'll take that back to our comms team and see if we can tidy that up a little bit.
Thank you.
I think Councillor Suzanne Williams, Chairman.
Suzanne?
Hi, thank you. It has been an amazing programme, and I'm not going to put down on that. It's absolutely fantastic what you've done. My family, I thought everybody was sorted, but then I keep getting this message telling me to go for my booster. I thought, so I've been in touch, and for some reason it hasn't been recorded. And that was over a week ago, and someone's supposed to contact me, nobody has yet. And I know that I'm having that issue. Then it's.
We're losing you, Suzanne. You might need to turn your video on. If we've got a problem with your question, we will come back to you. And any questions that members wish to submit to myself in writing, we can forward to Katie and Caroline and Una after the meeting. So I think we might have come to a natural end. Poor Suzanne, we've lost her. But we will. Any questions, members, that you want to send to me, then we will forward on and we will get responses to you. Is that all right with you, Katie and Caroline? Thank you very much.
Absolutely, thank you.
Thank you very much for your time. You're doing a great job, and the figures show that. Thank you.
Members, did you want to, could I just ask and check that, were there any questions for Mark in connection with the Chief Fire Officer report?
For the time being, item 7 to pick up on questions to Mark, Chief Fire Officer. Everybody satisfied on Mark's contribution? And particularly the ongoing work with fireworks.
I can see Councillor Terry Hale waving his hand and Councillor Steve Robinson.
Terry? You're muted.
I'll make a change. Thank you, Stephen. Just to ask Mark, there in the report was animal disease that actually I've lost it off my screen, but it's animal disease exercise that they've completed. Is that one out for release now, or is, only being from the Forest of Dean trading standards got a lot to do with the sheep and the welfare of the sheep, the free roaming sheep, and I'd like to have a word with Mark sometime. With the commoners and Mark, just to see whether we could come to some agreement on the ancient bylaws that's been put through, or they have been for years on the table, but nothing seems to be done. Forestry Commission, police. There is it is a difficult subject, and I would like to talk to Mark and see what we could sort out.
Would you like me to arrange that between yourself, Mark, and Councillor Hale after the meeting?
If you would do, thank you, Joe, and obviously involve Karen from Trading Standards, but happy to come out and meet Councillor Hale in the Forest of Dean to talk through those issues.
Yeah, would you like me to do that? Yeah, okay. I'll take that as an action.
Yeah, thank you.
Thank you, Mark. Thank you.
Councillor
Suzanne Williams, we lost you, unfortunately. We just suggested that anyone wanting to submit any questions on the vaccine programme to send them to myself, and we'll relay them to the team. Is that okay with you? Sorry about that.
That's fine. Sorry, I looked up and saw I'd got it gone. I thought, here we go again, round and round circles.
But any questions,
right,
please send to myself. That would be great.
Okay, thank you.
Thank you. Councillor Steve Robinson has his hand up, Chairman.
Steve Robinson.
Thank you, Stephen. Mark, for your presentation. Just on the pathologist, and you mentioned that that you've got somebody 2 days a week and they're retiring. How easy is it to find pathologists to fill that post? You know, there seems a shortage of everything in the country at the moment. I just wondered how easy it will be, and with the current, just that one, and also with the current pathologists, I wonder whether there was a cost implication, because are they through an agency or whatever, or you know, are they straightforwardly employed by the county?
Okay, on your two questions, Councillor, I think the first one is that what we're doing to address the skills gap is that we've got trainee pathologists as well, so we're trying to grow our own as well within the team, as well as recruit externally if we possibly can. And then in terms of the employment arrangement, I believe he's employed directly to us. He works within a hospital and does a couple of days a week, also for ourselves as well, and that's the arrangement. We don't use a third party to secure those skills.
Thank you. I'm pleased to grow your own. It's a great, yeah. Thank you.
Is everybody happy following Mark's answer to the questions? Yes, thank you, Mark, for being patient and hanging on a while.
No problem, Chair. Thank you.
Thank you. We now come to, are we on item 9, Joe?
I think we need to go back to Sarah to finish or to complete her report, the public health report, item 8. Is that right, Sarah?
I think she's just had to step away momentarily. It is right, I believe, and I can start with the COVID section of that.
Sorry, I'm back.
Okay, she's back.
Apologies. Sorry, double running a bit today. Do you want me just to do the public health report really quickly?
Yes, really quickly.
So I'm conscious that we're short of time. So a lot of the issues in this public health report information relate to questions the committee raised at an earlier meeting. So I think there was a question around prevalence of sexually transmitted infections, and so in the report you've got an update around that and the impact the pandemic had on sexual health services. We'll also give a short update on drug and alcohol services, specifically in relation to their work with the voluntary and community sector, which I think was a question we had at the last committee.
That's page 83, agenda item 8.
Yes. And there is an update on childhood obesity and the recent data release and some plans for service developments there. I think the one thing I would draw your attention to is the domestic abuse update in that particular paper. So it talks about a council motion that was presented to council, I think, at the last council meeting, and has an ask of this committee and of the Children and Family Scrutiny Committee, and it relates to the provision of accommodation in relation to people who've been victims of domestic abuse. And I suppose I wanted just to test out with the committee how we wanted to respond to this particular council motion. Our recommendation is that we bring the two committees together and bring in some of the officers to do a presentation on our approach to our new domestic abuse duties as outlined in the summary form in this paper. The Domestic Abuse Act came into force last year, and the team have been very busy working with district colleagues to fulfil the statutory requirements. But I think the difficulty is the motion related to two different scrutiny committees. So would you like to, for example, invite the Children and Family Scrutiny Committee to attend the May meeting of this committee and we can respond to this council motion then? Or does the committee have another suggestion in terms of how we could best meet the outcome of this motion?
Your suggestion would be the best one.
If members don't have an alternative suggestion, could you indicate with a nod of the head that you're happy for Sarah and her team to invite the children and family members, scrutiny members, to our May meeting, and we have an in-depth presentation at that meeting, from which we would probably be required to prepare or produce a response that would go back to full council after that meeting. Would members be in agreement?
If you're happy, will you show?
Would you want to raise your hand? Yes, please. I think that's
okay. I'll work with Joe to make the
Yeah.
arrangements,
Okay.
and then we can respond after the May scrutiny to the council
That's
motion.
grand, thank you.
and I'll produce something to
I
send
don't-
out to everyone. Yeah.
So that's what I wanted to say on the paper. I don't think there are any questions at all on the information in it. Steve.
Oh, sorry, I've jumped the gun, have I?
I
Right.
think Steve had his hand up first, Pam. Sorry.
No, it keeps telling me to stop my video on here. I don't know what the hell's going on. Battery. Oh, get me back in.
Councillor Robinson, hailing from Nailsworth, who is mute.
Yeah. Just thank you, Sarah. One is on it says on the drugs and alcohol update that Bananos and Young Gloss are dealing with 16 to 25s regarding that. Do we have a service that's dealing with under 16s? Because we don't know. We all know that there will be some younger than that will be dabbling in drugs, for instance. And also, you mentioned about the obesity and I take it their trial in both. I'm looking at it wherever it was. Anyway, there were two trial schemes. I take it in two areas in Gloucestershire. One was one in the Forest and one in Quedgeley or whatever. Will they be rolled out across the county if they've been successful?
So in answer to the question, so yes, there is a young people's drug and alcohol service, but we don't commission it from within public health. It's commissioned from children and families services within the county council. So we can provide some summary of the information in terms of the service, but it's not commissioned by my team. So I can get a paragraph and share that with Joe, perhaps for the minutes, just for your information. And then in relation to the obesity services, so the pilots have been reasonably successful. In the papers going to Cabinet tomorrow and then hopefully be presented to full council in February, in the MTFS there is an element in the public health grant that will provide recurrent funding for a children's weight management service. So subject to Cabinet and Council approval, the programme will continue, and we're really excited about that, about the prospect. And I think the weight management is down to come for an update to the committee further on in the year, isn't it, Joe?
I think we've got it earmarked actually for the joint meeting, for the March meeting. So there will be more information to come to the committee on that one.
Yeah. So that will be rolled out across the county, you're saying?
Well, subject to the funding being agreed, and I think I don't think we can say it will be rolled out completely across the counties. What we're doing is we are working in areas where we find significant levels of deprivation, because we know, as you can see in the report, that we see increased levels of obesity where it correlates to areas of deprivation. So I don't think I can say now it will be necessarily a universal county-wide service. It will be targeted.
Thank you.
Thank you. Anybody else? Kate, sorry.
Thank you. Yeah, just on Councillor Robinson's point there, yesterday there was a children's committee seminar to which this committee were actually invited, and it would definitely be worth having a look at the slides. There's some really positive things. Actually, children trying drugs, and particularly alcohol, has significantly gone down, and there was some really interesting stats and information there. So you could possibly ask for those or have a look at that, because there was a lot of focus on that in one of the polls and things that went on yesterday.
Yeah.
Those slides and any information that comes from that, Kate, will be circulated to this committee and the Health Scrutiny Committee. So I will be sending, as soon as we get that information, I will circulate it to everyone. Thank you.
I'll have a go again. Yeah, I'm dealing right now. I'm dealing with the Deputy Crime Commissioner. There's a lot of drinking in this city centre, even in the zones with children, and also down the bottom of Westgate Street. They're along there under that wall drinking. But you know what? It's also everywhere. Is all these little silver canisters in piles and piles and piles. You can sweep them out. I mean, they're going in like behind these closets in Tuffley. There's Wingate's there. There's piles there. There's piles everywhere. Where are they getting these silver cylinders from? Yeah, and also, Sarah, going back again at what you said about paying out and blah blah blah. And I was going to say on that, what about children's homes? Do they get help and relief for the staff who work through the pandemic in the children's home? I know I'm going reverse and back, so you don't have to answer. But when you mentioned about the children's groups coming to the committee, and I thought, well, perhaps I should have asked that question before. Thank you.
As far as I'm aware, if they're a CQC registered home, then they could apply to have the money to allocate to their staff. As far as I'm aware, I don't know that was restricted to older people's care homes, because we've obviously offered it to people, care homes that look after people with disabilities.
Yeah,
Joe, I'll check.
No, it's no problem. I know you will, but I'm not. And what about these silver canisters and all that with these children? Are they gone for sniffing this stuff? But where are they buying all these silver canisters from? I bet you've seen them when you walked around.
I have. I'm not quite sure where they're buying them from, though. I think there is something around, is it a police matter? Is it an issue around drug and alcohol? Is it around youth services? Is it about the kids haven't got anything else to do? It's quite a difficult scenario, isn't it? I think there's it's probably quite a good thing for the Safer Gloucestershire partnership to discuss, I think, in terms of sort of young to prevent young offending and to try and encourage young people to participate in activities that perhaps aren't going to lead them onto a course of offending.
We need to get the youth clubs going again. Right. Thank you.
Can I just tell Pam, they're nitrous oxide, and they have a legal use as well as an illegal one. They use them for creamers and that sort of stuff. And they buy them online. You can get a big box for next to nothing online.
And what do you do with them, Suzanne?
I haven't personally done anything with them, but they do use them as a. They do sniff them for an accelerant in that way, yeah. But they are for, as I say, for creamers and that sort of stuff to make frothy coffees and things like that.
Right.
Well, we need to look into that then. They're everywhere these times.
And what's a frothy coffee next time round? Okay.
I hope you're not on there.
No.
Thank you for that.
Any more questions and comments, members?
Sorry, Chair.
All right, you're all drinking your coffee. Okay, thank you. Where are we now, Joe?
We're now moving on to item 9, Chairman, which is the Adult Social Care Report. And Sarah, once again, poor Sarah.
Sorry, can I just say that there's a fairly detailed report in your pack that Siobhan was going to lead us through around COVID. So I'm going to hand over to Siobhan there, because I think it provides the committee with an important update on the work that we've been doing
about that, Sarah.
around COVID. Over to you, Siobhan.
Thanks. I will keep it brief. I'm very aware of the time. I think it's important for the committee to note that as things do with COVID, things have moved on quite significantly since the report was published. So a lot of the information in there around the guidance, etc., is now out of date. For example, we are no longer on an emergence of the Omicron variant. It is now the dominant strain in the UK. I'll run through the headings just to kind of give you the headline update, and the changes to self-isolation and testing guidance for cases. So you'll be aware that that was reduced to 7 days, and then it's actually gone now down to 5 days. Yeah, exactly, with a test on day 5 and day 6 to make sure that you are negative. So that's another change there. And the other significant change around testing for people who test positive for COVID is that they no longer need to get a confirmatory PCR test. So as long as you get a lateral flow result, then you need to consider yourself positive. Now that's quite important because that means that we've got an interesting situation with the figures nationally at the moment, and it's likely that the fact that people aren't having to go for that confirmatory PCR test but have to record their own positive result means that we might have seen an impact of that and seen the reduction in cases over the last few weeks. It's worth noting that the figures have started to creep up again in the last 7 days, and that's likely to do with the younger age group now being back at school and outbreaks having again started to occur in school. And you'll particularly note that that's in the younger age groups, in primary school children who aren't vaccinated or indeed didn't have perhaps the rates of COVID at the end of last term. And the vaccination campaign is, as you've already heard, still being rolled out in secondary schools. So I think we just have to watch and wait. There is I'll just run through the other updates and then kind of talk about the overall plans for the future. So changes to self-isolation for close contacts. So you're no longer required to self-isolate if you're a close contact if you are vaccinated. If you're not vaccinated, rules do still apply. Community testing, we do still have a programme which is targeted at specific areas to ensure that people know where to get their lateral flow tests and how to take them regularly, etc. And that goes out to hard to reach communities that we discuss, similar to the vaccine equality group, as you've already heard. Local contact tracing, you can imagine with the numbers that's significantly increased. There's a lot more people to contact trace, but there's reviews going on nationally to look at how long that will continue for as rates remain very high. Omicron is now a milder variant, but also we have very high vaccination. The value of contact tracing and hunting down every single person that's been exposed is lowered, and so we need to look at whether or not that's the best use of time moving forward. That said, any should be isolating and isn't. If the contact tracers do get hold of them, then that's obviously some spread prevented. So it does have an impact, but the question is if it's enough impact to warrant continuing it. Education and childcare settings I've touched on. Obviously, there's been changes in the last week to recommendations around mask wearing. And we're continuing to work really closely with the schools in Gloucestershire to make sure they know what to do if they do have an outbreak, and recommending locally that they can choose to wear masks if they think it will help prevent spread. So they do have quite a lot of flexibility, even though the national recommendation is around reducing that mask wearing. Care home outbreak, we talked a little bit about that. It's worth noting that rates, particularly in staff, are still very high, and we've seen an awful lot of outbreaks in the past 6 weeks since the Omicron variants hit. The good news is hardly any of those cases are translating into hospital admissions, which is really good news and shows that vaccination is working. I'm not saying none, because of course there are still some people who, no matter if they're vaccinated, will still not get the full immune response, but we're in a much better position than last year. However, you'll be aware that the ongoing kind of admissions do cause pressure on the NHS, so it is something that the government are keeping an eye on. Vaccines, I'm not going to go into. I think you had a very thorough update earlier. And then finally, the item just to draw your attention to is on the Contained Outbreak Management Fund, which I'll come back to in just one second. So just to say that kind of overall update on COVID is there for you. You'll be aware that the latest government guidance is to move away from Plan B over the next few days. And to eventually step away from any restrictions at all, including removing self-isolation potentially from the 24th of March. That will move us to a place where we are effectively living with COVID in a similar way we live with flu. But there are some things to note there that perhaps we've never done enough around flu and making sure everybody's vaccinated and preventing flu outbreaks either, because it does cause excess mortality. So I think there's a happy medium to be found moving forward, especially in care homes, about how we reduce infection and prevent prevent avoidable deaths essentially. But that conversation will continue with partners in UK Health Security Agency. So the final item, just to come back then, is that very comprehensive update provided by Mary Peplow, who is managing our Contained Outbreak Management Fund. This is a significant sum of money that Cabinet delegated to Sarah to spend in consultation with Tim and Steve Mawson, and the list of all of the projects that we've allocated funding to is in that report from page 98 onwards. I hope you will see that it's been spent on a combination of measures to prevent outbreaks and prevent spread, but then where we feel that there is benefit on it's been spent on activities to try and improve overall community resilience and reduce health inequalities, because we know that the people most affected by COVID were our most deprived communities. So there will be a further report on this later in the year. We're going to be doing quarterly reports to the Health Protection Board, and we'll bring an update to Scrutiny as appropriate. But we just wanted to make sure the committee was cited on that wide range of activity that's been going on to prevent COVID. And I just want to offer my formal thanks to every single person that's put in a business case for the funding, because it does take effort, and to make sure that we're spending it effectively, and to Mary for her oversight and monitoring of it, so that Sarah is assured the funding is being spent appropriately. So that's it from me. Hopefully that was quick enough given the detail in the report.
Thank you. Do we have any questions? May I ask a question, please, Siobhan? Is this the last variant that we'll hear of, or are there more variants coming down the line?
Unfortunately, Councillor Hurst, I wish I could tell you it was, but there's already a variant under investigation been announced in the last week. That's a spin-off of the Omicron variant. Quite honestly, whilst there remain such high levels of unvaccinated people across the world, not in the UK, but there will likely be further variants. How severe they will be or how the spread happens, I think we have to wait and see. We will continue to monitor strains of COVID, so anybody that goes to hospital will have their samples, what we call strain typed, to make sure that we know what strain it is, and there'll continue to be surveillance of infection in the country so we can spot variants. But once we kind of move away from that mass testing, we do have to go back to sort of usual, business as usual monitoring and keeping in touch with the World Health Organization, etc. I hope that we only see more mild variants from now on, but absolutely cannot give you any promises about that, I'm afraid.
But the message continues to be vaccinated, doesn't it?
Absolutely remains the best measure. The
Yes.
one thing I can just mention to the committee is there is hope, of course, that we will end up with what we would call a polyvalent vaccine in the near future, which would vaccinate us against a number of strains of COVID, like flu does at the moment, but we're not there yet with the vaccine technology.
Will we get to an oral measure against it, taking the pill?
Not to prevent, but there are already now antivirals available to take in a care home situation, for example, to reduce the severity of impact. So we've got one in flu that's called Tamiflu, usually that's the brand name, and we've got similar antiviral drugs that we can now use. So whilst it won't prevent, it will help treat and therefore reduce morbidity, which is great, obviously, in a care home situation.
Thank you very much. Do we have any more questions?
Yeah, Stephen was Terry Hale.
Yes, Councillor Hale.
Could I ask, we've all worn masks for 18 months, 2 years now. Has that made any difference to the number of flu cases that we normally get in the winter? Just wondered whether wearing a mask have made a difference to catching the flu.
So what's been really interesting, Councillor Hale, is that the rates of other diseases, winter diseases, have been much lower. And that doesn't just include flu, it includes things like the winter vomiting bug, which its proper name is norovirus. And we've seen lower, we have seen quite a high rate of RSV, which is another viral condition. But again, we do believe that that's been attenuated by the general measures of hygiene that we take now. So hand sanitizing and mask wearing, absolutely. I do think there's a conversation to be had with the public about the acceptability of masks moving forward. And if you are ill, perhaps wearing one to protect others when you're out and about. I think it's incredibly sensible, but whether or not now is the time for that public conversation, I don't know. And I would imagine that, next winter that may well be something we're saying to people is, if you're sick, protect others by wearing masks and sanitize your hands. I would love to see the hand sanitizers remain in shops, etc. I think it's a great public health measure that we is very sensible. So it looks like it's had an impact, but to quantify that's very difficult. It's always hard to know what didn't happen, isn't it?
It's good to hear. Thank you very much.
Everybody happy?
Mm-hmm.
Okay. Thank you very much.
I think, unless Sarah wishes to come back, I think we might be moving on to item 9. Is that right, Sarah? Apologies about missing the
It is, yes.
COVID report.
So I think I'm assuming you've had a chance to read the adult social care report. It's quite short this time, bearing in mind we had 3 items for scrutiny today. And very much, I think, just try to provide an update on where we are with key change issues like the adult social care reform, but also responds to some of the questions we were asked at the last committee. So I'm happy just to leave it there and respond to questions, Chair.
Okay, thank you, Sarah. Any questions? It appears not. Nope. Okay, thank you.
Well, I think Lisa's got a hand up, Chair.
Lisa?
Yeah, thank you. I've just had to move to my kitchen because I'm freezing. I was just wondering, Sarah, how concerned you are, or what your levels of concern are about recruitment ongoing in every care sector, really, because I know you've mentioned before, we know the vaccine has been, or mandatory vaccines has been an issue, Brexit, etc. But how are we looking?
Well, I suppose I am concerned, and what I don't have to hand is the numbers of vacant posts necessarily, because they're all independent businesses and it would take a huge amount of resource to try and capture that information. So I am concerned. I think we have got a wide range of activities to try and increase recruitment. We experience recruitment and retention issues in our own adult social care staff in the county council, because of course we run some in-house services ourselves. So we're experiencing that ourselves. We sometimes find it difficult to attract social workers, for example. So there's quite a comprehensive programme of work around recruitment and retention. So I've highlighted the key elements of it for you today. I think the longer term is around how much do we pay our sector, and I think we need to do the cost of care exercise to establish that. But it is really worrying, because we run on our staff, don't we? As an organisation, as a GCC, we're wholly dependent on our staff to deliver services, all the many hundreds of different services that we deliver or commission. And the same could be said for the adult social care sector. So I think we're just trying to we're constantly looking for any new idea that might help or has had an impact elsewhere. So the networks that we have through the Association of Directors of Adult Social Services are really important to try and learn what's worked elsewhere. And of course, the additional money from the government has been really helpful.
Okay, and there could be some more money coming from the government, couldn't there?
There will be some more following the care cap. Yeah, we've been notified about that.
It's still our care staff in their organisations.
Yeah.
And it's important that is happening. Okay. Thank you. Are we on to work plan, Joe?
We are. I would say enormous thanks to all the officers who've produced reports. It's been a mammoth, really, meeting with so much information. So I would say to members again, if there's any questions that they may think of or that they may wish to ask after the meeting, please send them in. There's been an awful lot of information to absorb and digest, and excellent presentations. Going forward, we've got quite a number of items to add to the work plan that are not already on there. Just to remind members that the 8th of March meeting is the joint meeting with the Health Overview and Scrutiny Committee. So that's a joint meeting which officers and the chairs of the two committees are going to discuss how we're going to do that meeting and in what format, whether we have reports or presentations. At that meeting at the moment, and there will be a discussion, will be the winter plan review to look at how the winter plan has addressed all the issues that it's had sort of to bear and to has been challenged with. Sarah, I think we are going to have something on the child measurement programme at the next meeting. Is that correct?
childhood obesity, yes, I think so.
Yes.
That was on the
Yeah.
outline plan, wasn't it?
Yeah, we had marked down immunisation and vaccination equity presentation, but I think we've covered that today. Is that right? Or do you want to come back with more on that one?
I think the suggestion was that we had a specific presentation on the broader, I think it was vaccination programme, wasn't it, Siobhan?
Yeah,
so,
for both committees.
Yeah, for both committees. I do wonder, those three are quite three meaty issues for one committee.
Yeah.
So I might need to have a think about whether we want all of those, because I think the discussion about the winter plan and system flow certainly has occupied a huge amount of my time and my team's time. So Siobhan's got a hand up here.
If I could make perhaps a suggestion. So given that the immunisation update is a broader one, you're right, Sarah, thank you for reminding me, whether or not that is covered in the meeting that you invite the Children's Scrutiny Committee to, given that many of the immunisations are childhood, and whether that would make sense. So you see the wide variety, some are child, some are adults. So that might be something, and then have it when you have the domestic abuse update.
That's earmarked for the 10th of May meeting, Siobhan. So shall I leave Siobhan to talk about that one, and we'll come back to the committee on that if everybody's happy. And so for the May meeting, we were considering having an update on the domestic abuse motion, which is for both committees, for children and families and for this committee. And I think because of the comments from the committee to Mark about fireworks and licensing, that we're going to switch presentations and have the trading standards presentation as part of your report to the May meeting, Mark. Is that in your understanding? Yeah, brilliant. And so the civil protection presentation, which forms part of Mark's report, will be at the 5th of July meeting. And I can inform members that we've had a request from Jane Everest about the new library strategy that's going out to consultation over the summer months, and she's suggesting she brings a paper to the committee in July, that if this committee want to comment or make a contribution to the consultation, that they can do so following a presentation at that meeting. So that's my little bit of an update. Sarah, Siobhan, myself, the chairman, will update the work plan to encapsulate all those, and Mark, and then we'll circulate it to members. Chairman, do you want to ask if there's any other issues that members wish to add to the list of items for future consideration?
Yes, I think we should just rattle our minds around a bit. Are there any other issues which members want to bring to the committee which aren't already listed on the work plan? If you think on later, you can always contact Joe with what you wish to see on the next agendas.
Yeah, please email any suggestions going forward. We will recirculate the work plan. Mark, did you want to say something? I saw your hand.
Yes, it just occurred to me that if you could just give us a preliminary update of what you've talked, we see what's on the list and when it's scheduled. That might just spark something in our little grey matters to come up with other ideas.
Yeah. I'll do a summary of what we've had before, but we've got the work plan on the back of the agenda, but that will be updated. We will recirculate it, and some items that you've considered before, and we'll send that out to members. Yeah. Okay.
If you think we've missed anything, give us a shout.
I do apologise for the technical issues today. I think the challenges have been immense, both here at Shire Hall and with you in your homes. My understanding, just to let you know, is that we're hopeful that the next meetings in March will be face to face. That's the intention. So I really do hope that we all can, for the very first time, I think, get together and see one another at the March meeting. So thank you, Chair.
Yes, thank you, Joe. And thank you to all the officers for contributions today. In some ways, it's been a very complicated meeting, but everyone's been very stoical. We've got through it with great aplomb. Thank you all very, very much indeed. And also thanks to members for some interesting questions and interest, because we deal with some very important subjects. Thank you very much indeed for attending. Thank you.